Another way that we will deactivate the nervous system by that release. And if you have had a really stressful event and found that you burst into tears, or sometimes people will talk about even during a really intense workout, like bursting into tears afterward, after that kind of accomplishment, because the nervous system is still elevated, and then that's a way of bringing it back down. And creative expression. So this is, maybe not, again, initially all of that obvious, but we don't engage the creative part of the brain if we're in that shutdown mode of high stress. So by engaging something creatively, you're signaling we can turn this part of the body off, the brain off, and go into this part of the brain. So and we'll come back to these over the course of our discussion today, but I wanted them to be there upfront so we could understand how to complete the stress cycle. And often the stress isn't the problem, it's that we're not completing the stress cycle that's the problem, especially when it's these little things. So many of you, I'm sure, as in my day, your schedules, you have, maybe those 7 to 10 minutes off between clients, you're not necessarily taking the time to go, wow, that was really stressful. You're writing your note, you're running to the bathroom, you're getting a drink, and you're coming back to your work. Okay. Little pause, and I'm going to be a little quick initially through our activities since we lost some time at the beginning. And that's a good place to recover some time, but we'll see how time is starting to work over the course of this. So I just want you to take a moment to choose a simple way to complete the stress cycle. Maybe talking about burnout, elevated some stress, maybe you're just getting on, maybe those little interruptions of recording in progress, recording stopped, have brought the nervous system up a little bit. I know my brain said, did I do something wrong? So just take a moment and choose a way to complete the stress cycle. You can get up and stretch. You can draw something on your pad of paper. This is a time to grab those colored pencils I recommended people have nearby. Or you can engage in some diaphragmatic breathing. I would show you the exhaler.com app, which is an excellent visual. It's that like circle that goes up and expands and then decreases. But I'm scared to open Windows on my computer right now because I don't want things to get messed up. So just take a moment and complete the stress cycle. I think I'm going to choose just a simple stretch. So from the mind-body network, the brain, again, these older parts of the brain don't understand why the body is tense. They just register that it's tense. So they don't know if it's tense from your workout this morning or if it's tense because there's something really scary standing right behind you. So being able to tell your body, it's okay, you are safe. You can breathe into that space. All right. So shifting from general burnout to burnout in psychotherapy and with psychotherapists. We see exhaustion, cynicism, reduced professional efficacy, and decreased caring about one's clients. Simpson et al. In their 2018 study discussed workload as the most distressing aspect of psychotherapy in terms of burnout. It's the demand, the number of patients or clients being seen. COVID has increased the workload demands, the tsunami of need that's been cited frequently, and many people, if you're on the listserv, you see this frequently, looking for referral sources, doing second call outs because they haven't heard anything, and then in your own practices, I'm sure, having, again, the phone calls, the emails, the requests for services that are coming in constantly. And working from home has increased isolation and decreased access to movement, reducing our capacity to complete the stress cycle. And this may not be true for anyone. I know some providers that are still going into their offices, and maybe for some people there's more movement throughout the day because of working from home. But you know, I think for most of us, there's some shift in the rhythm and routine of how we work, given the last 19 months and how we've been practicing. All right. So what happens for psychotherapists specifically in burnout? There's a tendency for clinicians to overextend themselves with work. 52% of participants reported working overtime hours in any given week, resulting in symptoms of burnout. 52%. 61% of sampled psychotherapists met criteria for clinical depression. This is an older reference, but still true. And Simpson et al. Found 79% of respondents reported experiencing work-related stressors that impeded optimal therapy, with 72% reporting occasional rumination about this. And you know, we could think 72%, but it's pretty clear that there would be some rumination, some default brain thinking about this when people feel like they are not being effective in their work. Research suggests more than 30% of psychologists will have a client complete suicide at some point in their career. Upwards of 33% may subsequently suffer severe mental distress as a result. And literature suggests as many as 50% of all psychotherapists will experience harassment or, in some instances, physical attack by a client. Research also indicates between 75 to 82% of therapists reported experiencing a distressing event in the past 3 years. And Pope et al. In 87 found that up to 62% of psychotherapists reported working while too significantly distressed for it to be effective. And in my own kind of dissertation work, it was very clear that therapists in treating other psychotherapists had high concerns about when those individuals were working despite their own mental health challenges and difficulties. And that became one of the biggest issues and dilemmas for how to support that individual in that circumstance. The systemic review by McCormick that came out in 2018, strong and consistent relationship between high workload and burnout. So again, we see it's the caseload that quite often is the biggest contributor to burnout. Not only the amount of work, but the perceived accessory work. So that is the documentation, the billing, the calls to insurance company, the collateral contacts, all of those parts that can very quickly add up and be the death by 1,000 paper cuts. The tendency to put others' needs before their own can predispose psychologists to burnout. So this, again, piece of other-focused rather than self-focused. And a widespread evidence that social support is a strong protective factor. So if we can look outward, look to ourselves for support, that can be a resilience factor. But often research suggests that psychologists are hesitant to seek help. For example, 60% reported not seeking help, even though they needed it and could have benefited from it. There's growing evidence linking burnout with practice errors and ethical violations. Burnout refers in this Aubrey and Gentry study to the draining effects associated with an individual's interaction with the work environment. So here we see the shift from what I mentioned earlier, that it's not necessarily the worker who's not managing the work or the stress of the work, but the interaction with the work environment. So strong research support for the idea that the cause of the burnout is often the work environment and not the individual, especially resources or the lack thereof. And an advocation by Aubrey and Gentry for switching focus from external circumstances we can't control to ourselves and our responses, which we can control. And then we look again about what's been happening in the last 19 months and so much of a perception of things occurring that are not in our control, given whether it be the pandemic, whether it be the wildfires that happened last summer, or the protests and all of the activation around issues of social justice issues across the board. So focusing on self-regulation, building and strengthening our parasympathetic nervous system, going back to that slide of the two working in harmony, and strengthening our vagal tone and other resilience skills as a means of inoculation against burnout and stress-related conditions. So very often we focus on kind of calming down the sympathetic nervous system, but we can also strengthen the parasympathetic response. We can do things that help build more resilience and again, strengthen the vagal tone. So vagal tone being the vagus nerve, which is the 10th cranial nerve originating around here and moving through the whole body, touching on almost every system and ending in the gut. So one of the big reasons why we often see gut difficulties with stress difficulties. So there are ways of strengthening that through self-compassion, through yoga, through breath work, through self-awareness. All right, taking a moment to focus in a little bit, burnout in clinicians of color. There's a Forbes article that unfortunately I've not seen cited as often as the other Forbes article, but we need to talk about Black therapist burnout. Younger clinicians, and especially clinicians of color, report feeling burnout more than their older white counterparts. And the most distressing part about this in this article that I was reading, it's actually that came out of not the Forbes article, but another one that I can reference if you like. It was actually published through the Simple Practice website's newsletter, the Pollen, that talked about being less likely to recommend to their friends or other generations coming into the field because of the burnout, which is highly, highly problematic. And in that we have so few clinicians of color and are really trying to recruit and encourage clinicians of color to come into the field. So burnout could be really detrimental, not just to those clinicians, but to the field if it has that deleterious effect of attracting and recruiting people to the field. So one of the individuals in this article stating, so we've seen a lot of re-traumatizing and re-triggering. We all have to constantly be reminded, oh, right, there are people who hate me just because I'm me. So this added piece of working through the social justice and racial inequities that have been highlighted so much in the last 20 months and have always been present, but are just getting really highlighted right now. And then, so especially for clinicians of color, watching all these things as our clients are also experiencing them, that stress has been compounding for a long time. Of course, we're more burnout. It's already been this way for us. So the death by 1,000 paper cuts, that has so compounded in these situations. The Forbes article, two things I wanted to just take out of that, a direct quote, due to the civil and political unrest that this country has endured over this past year and the impact that COVID-19 has had on communities of color, individuals of color are reaching out to doctors and mental health professionals who look like them. They feel safe with professionals who look like them. This is difficult, however, as only 4% of psychologists and only 2% of psychiatrists are Black. So how incredibly stressful that may be if we're all feeling this stress of the tsunami of need of all of these demands, but if you have that even more so compounded exponentially, if you are a clinician of color or a Black clinician who's having all these people reach out to you to help because of what's been happening and the traumas they've been exposed to. An individual in the article states, I'm often contacted to help chime in on diversity issues, such as former executive order banning diversity trainings, addressing racial tensions amid police murders across the country. Part of me wants to help, but I have largely been exploited at times or taken advantage of for being Black and being perceived as accommodating. So the system is not providing adequate resources and then is in and of itself making demands on the individual. And so this is not, again, a person that is not managing stress. This is a system that's not supporting a person so that they can be effective and not move into burnout. Burnout is the syndrome of emotional exhaustion, depersonalization, and reduced personal accomplishment as a result of perceived demands that outweigh the perceived resources to accomplish those perceived demands. So I think that's worth restating. Burnout is the syndrome of emotional exhaustion, depersonalization, and reduced personal accomplishment as a result of perceived demands that outweigh the perceived resources to accomplish those perceived demands. All right. So in 2007, a little dated, but the APA Board of Professional Affairs Advisory Committee on Colleague Assistance did a survey and found that the issues that were most likely to affect psychologists' function, but 100% of psychologists who had experienced traumatic events were impacted by them. 86% discussed licensing board complaints, 54% indicated stress and burnout, 48% vicarious trauma or compassion fatigue, and 25% anxiety. And these were the most frequent responses to those problems: talking to a colleague, exercise, seeking family or social support, consultation, supervision, psychotherapy, counseling, reducing the clinical load, and participating in hobbies or activities. So we see within these responses some of the ways of closing the stress cycle, right? The social response, the physical response, connection with family, connections with other professionals. All right, so we're going to take another moment to check in. I invite you again to just notice, perhaps grounding back into the support of the land that we acknowledged as we started. And noticing your breath. Is it shallow or deep? Your physical tension or softness, your emotional tone, your thoughts and focus, and your energy. And maybe jotting down if there's anything that stands out. Okay, I'm going to talk about assessing burnout and some of the tools that we utilize for assessing burnout. And once we finish through this section, we'll move into our first break, and we'll also be able to take some questions if there's some questions. So many of these slides come out of the Professional Quality of Life Inventory, and I cite at the end of them their website and how you can access more of this information. And I highly, highly recommend taking the Professional Quality of Life Inventory. I will share, like many things, when we are a little bit anxious, we tend to be a little bit avoidant. So how somebody may not step on the scale if it's been a while and they've been enjoying their snacks, or somebody may not want to take a depression inventory because they suspect maybe they're depressed. There was part of me that avoided taking the Professional Quality of Life Inventory for a while because I was like, I don't really want to know how burnt out I am, and not if, how burnt out I am. But it was incredibly helpful when I did take it, and I find it a really useful tool to check in with. And as discussed at the beginning, these burnout fluctuates. And so having a measure, we're scientists practitioners, having a measure to look at it is incredibly useful and can be encouraging, because in my own profile, I found there was a little burnout. There was also high job satisfaction, and there was very little vicarious traumatization. So it was mostly good news. So these can be very helpful tools. So let's talk a little bit more about what they are. Some vocabulary: compassion, satisfaction, the positive aspects of working as a helper. And these exist. We're focusing some on burnout right now, but we're going to focus more on some of the positive aspects of working as a helper. And then compassion fatigue, the negative aspects of working as a helper. Burnout, inefficacy, and feeling overwhelmed. So slightly different definition, but again, there's that stress on overwhelm, exhaustion. And then work-related traumatic stress, primary traumatic stress, where there's the individual is the direct target of the event, so something traumatic happening to the provider, or a secondary traumatic exposure to an event due to relationship with the primary person. So this would be the vicarious trauma of a client discussing or sharing distress or experiencing traumatic distress. So in the professional quality of life, we have this balance between compassion satisfaction and compassion fatigue. The positive aspects are the good stuff, the negative aspects or the bad stuff. And this is the model that they provide through their framework for this inventory, that looking on the one side of compassion satisfaction that comes from professional quality of life, and then compassion fatigue that's broken down into burnout or secondary trauma, which are different things. And we don't go as much into secondary trauma today, but again, more about a specific event versus cumulative events over time. So compassion satisfaction, again, the positive aspects of helping. Pleasure and satisfaction derive from working in helping caregiving systems. Pleasure and satisfaction. These may be related to providing care. They may be related to the system, to working with colleagues, to beliefs about the self, or to just the altruism of helping. And compassion fatigue, the negative aspects of helping, the negative aspects of working in helping systems that may be related to providing care, to the system, work with colleagues, beliefs about self, burnout, and work-related trauma. So some of the same things that can lead to negative aspects or positive aspects. And here again, we see the system, and if it's not resourced, that can impact the individual. Burnout, work-related hopelessness and feelings of inefficacy. Again, feelings, not necessarily actual impairment or inefficacy, but we know burnout can lead ultimately to some poor choices and poor judgment. And then secondary traumatic stress, work-related secondary exposure to extremely or traumatically stressful events. Both share negative effect. Burnout is about being worn out. Secondary traumatic stress is about being afraid. Complexity of relationships, multiple spheres in the work environment, people are helped, and then there's the personal environment of the helper, what's happening in their own personal life, not just in the work environment. So compassion satisfaction, compassion fatigue, altruism can override. So compassion satisfaction can override compassion fatigue. And then there's the two parts of compassion fatigue, again, being worn out, and then frightened, traumatized, which is more rare, but very powerful. And this is just a visual really going through the same thing, right? The work environment, the client environment, and the personal environment. We can have satisfaction, or we can have fatigue, or we can have trauma. Compassion fatigue can lead to exhaustion, frustration, anger, depression. So these different areas that can be affected throughout the whole of professional quality of life. So measuring compassion satisfaction and compassion fatigue with the professional quality of life scale, the ProQual. It's a free scale. It's a 30-item self-report measure of the positive and negative aspects of caring. It measures compassion satisfaction and compassion fatigue. And there are two subscales provided for compassion fatigue, one being burnout and one being secondary trauma. So you would get scored on satisfaction, burnout, secondary trauma. It's very well established. It's been one of the most widely used measures of the positive and negative aspects of helping in the world. It's proven to be a valid measure of compassion, satisfaction, and fatigue. It's been used for over 15 years and was developed with data from over 3,000 people. It's very easy to use. It can be given individually or in groups. It can be given online or at an individual computer, or you can print it out on paper and use a pen and paper, which is what I did. And their scoring instructions are included on the website. So easy to score. There's some full scoring for more detailed and more specific information, but it takes a little longer. The simplified scoring is just really nice and quick in counting things up, and it gives you those index scores for each of those 3 domains. It's It's not a medical test, helps you understand the positive and negative aspects of helping, and can be viewed as a screening for stress-related health problems. So it's a really nice check-in. Again, going back to self-awareness, it's a way of getting a little bit of an objective measure of how am I doing right now and what's contributing to that. Maybe my burnout isn't that high, but my satisfaction is really low, or maybe my satisfaction is high, but my burnout is also really high, or maybe they all look great and that's good news. The scores on the individual scales tell us about a person's responses on each of the constructs. Viewing the combination of scores helps us paint a picture of what is going on for the individual. And it can be used to track compassion satisfaction and compassion fatigue over time. It can also be used for resiliency planning, individually per person, for organizational planning, or perhaps for supervision. This can be a really nice tool in consultation or supervision. This is Procall's website. I don't receive anything from them. I just feel like they.
I hate to interfere or interrupt, but your slides are not being shared currently. We need to have you share your screen.
Huh. Okay, let me see. I didn't change anything, so let me see what may have happened. Let me go to Zoom. Share screen. So I'm getting a message that says host disabled participant screen sharing.
Oh boy. One more. Continue and I will resolve this.
Okay. Okay, now it says I'm the co-host. Let me see.
There you go. Now you should be able to.
Okay. How far back should I go? When did we lose the slides?
I'm not sure. You've had them on for a while.
Okay. So, well, we'll just continue, and if that happens again, somebody wave your hands at me or let me know. All right, so that's the professional quality of life inventory, a really, really nice tool, really easy to use, really simple, oriented towards helping professionals. Maslach, who we discussed, was one of the first person in the 70s to talk about burnout, has her burnout inventory as well. Most commonly used tool to self-assess the risk of occupational burnout. It explores 3 components: exhaustion, depersonalization, and personal achievement. It's not intended to be diagnostic, but simply to make you aware that anyone may be at risk of burnout. So again, not a medical test, but it is a really good screening tool or assessment tool just to kind of track. The occupational exhaustion is defined as connected to a relationship with your work that is perceived as difficult, tiring, stressful. Maslach sees this as different from depression, and it is likely that the symptoms of burnout would be reduced during holidays or time away from work. So the person is only having these experiences related to their work or occupation, not generally across their life. The depersonalization scale, or loss of empathy. Depersonalization is characterized by a loss of regard for others, clients, colleagues, and by keeping a greater emotional distance, which is expressed through cynical, derogatory remarks, or even callousness. And then the impersonal accomplishment assessment. This is a feeling that acts as a safety valve and contributes to bringing about a balance if occupational exhaustion and depersonalization occur. It ensures fulfillment in the workplace and a positive view of professional achievements. So the resilience factor. So we go back to this would be compassion satisfaction versus compassion fatigue in Maslach's inventory. There are a couple additional tools, the Connor-Davidson Resilience Scale, and that's their website, and the Scovalt Practitioner Professional Resiliency and Self-Care Inventory. There's one other tool that I will talk about that many people are familiar with. Brene Brown's work. She's been very popular, and this comes out of her work of the gifts of imperfection. I will talk about this sometimes with clients because there may be a lot of buy-in around her work because it's so well published and well known. But she has the wholehearted inventory, which you can take online for free, and it's not recorded in terms of your data is not saved. It'll be emailed to you, and then it's not saved by them or utilized for their research. But it's just a very different way of looking at connection and involvement and some of the things that may be resilience factors for burnout. So she has these polls that, if you're familiar with her book, she talks about, and you get measures on each of those in terms of where you are. Letting go of versus cultivating what people think, or authenticity, perfectionism, self-compassion, numbing and powerlessness, resilient spirit, scarcity and fear of the dark versus gratitude and joy, comparison, creativity, exhaustion as a status symbol and productivity as self-worth, as opposed to play and rest, anxiety as a lifestyle versus calm and stillness, self-doubt and supposed to versus meaningful work, being cool and always in control versus laughter, song, and dance, unclear and uncommitted values versus values, clarity, and commitment. So again, not a medical test, not something with a very robust, validity necessarily, but a different, perhaps fun way to approach looking at, how am I doing? What might be missing? How am I tending to myself? Okay. So okay. I'm just going to go back here. So we're going to move into, I'm actually going to start with this. So I think we'll move into a break. It's been just over an hour. So we'll take about 5 minutes to break and come back. And in that time, we'll also just check in and see if there's some questions and some troubleshooting for everybody. So let's see, what's the time? I have 1:40, so around 1:45 or so, we'll aim at heading back. Does that make sense? Jeff, somebody? All right, take 5.
Yes, that sounds good. Thank you, Maura.
Okay. All right, I have about 1:45, but people may be kind of wandering back in. My computer says I am screen sharing and my audio and video are on. Can somebody give me thumbs up that that's the case? Thank you, Joe. I will have to say this, it's being very accustomed to telehealth. I was doing telehealth even before the pandemic because I had relocated from New Hampshire, where my practice was for many years, back to Oregon after being gone for some time and maintained some telehealth patients there. So I'm very used to the telehealth platform for individuals, but the group telehealth platform or the group, format for by video is just bizarre. It's like you feel like, I have no idea who is out there or if anybody is out there. So I'm going to regulate my nervous system around that and just trust and believe that you all are out there. So we're going to shift into an activity, and that way people can join us as they come back from break. And I want to take some time with this one. This is an activity that I adapted from Karen Sakvitny. I probably am not saying her name right. She gave us a trick for how to pronounce her name, but she is one of the longstanding clinicians and researchers on the East Coast who works with vicarious traumatization and compassion fatigue, coming out of an agency that does all work with survivors of sexual assault and high trauma population, and has developed tools for self-awareness and self-care and resiliency for herself and her providers and practitioners. And in a training I attended with her probably about 5 years ago now through the New Hampshire Psychological Association, she had us go through this exercise, and I still pull it out, which is part of why I recommend having a pad and paper that you can write this down on, and you may choose to keep it and revisit it. And so there's two questions to answer here. And the first is, how have you been changed by your work for the better? So take a few moments to just jot down some ways. This can be bullet points, it can be, short sentences, whatever works best for you. And I'm going to do it as well. Of how have you been changed by your work for the better? So if you're just joining us, we're answering these questions here. And then shifting as you're ready to answering the question, how have you been changed by your work for the worse? And this may be difficult to access initially, and if so, have some compassion for that, and try to access it. And nobody has to look at these, so you can be brutally honest with yourself. So one of the really powerful things about this activity, which when I first engaged in it was way pre-COVID, so we were in one of those hotel room conference halls with, coffee and bad pastries. We all miss that a lot. And we did the second part of the activity was to walk around in silence to our colleagues and to hold up our piece of paper that described the ways in which we felt we'd been changed by our work for the worst. And it was a not large but not small group, and there was a moment of like, oh, should I have written, more socially acceptable things? But people got up and did this activity. It was optional, but I think everybody did it. And it was so incredibly powerful because people were really honest. I think people really were in a place where they wanted to do this work of yes, this hits us hard sometimes. And it was amazing how much the same themes came up again and again, of maybe feeling some cynicism or losing hope in the world, maybe feeling less social than other people, or than formerly, people that had considered themselves pretty extroverted that now found that they kind of finished their day and just wanted to be away from people. So this kind of like not antisocial, but not engaging socially type feelings, and just other themes that came up. And it was very powerful and very connecting to say, okay, this is normal. This is so common in doing the work that we do, that we are changed by it, and we are very much changed by it for the better, but we are also changed for the worst sometimes, or in certain ways, or at certain times. There may be times we are not affected by it for the worst, but depending what's going on, we very much can be. And in acknowledging that and being aware of it, it can help us move through it and take better care of ourselves, and in so doing, better care of our clients and our colleagues. So thank you for engaging in that activity. And you don't have to walk around holding up your sign to the screen. I won't make you do that. But we will move, oh, my computer is not happy again. There we go. We will move back into a check-in. So just take another moment to come back and notice. How's your breath in your body? Is there any physical tension or loosening, any softness? Has the emotion shifted or changed? Is it the same? How are your thoughts? Wandering? How's your energy? So we're going to speak a little bit more about COVID and about burnout and COVID. And I encourage you to stay connected to that check-in, because this can elicit some tension. Even this photo, as I was searching for photos and putting together this presentation, elicited some tension of like, oh, this is our world now. There's like share photos of internet therapy. All right, so this data comes out of the 2021 American Psychological Association Stress in America survey that they conduct every year. In March 11, 2021, the World Health Organization declared COVID-19. This is making me teary. That hasn't happened in all of my run-throughs. A global pandemic. This is a big deal, right? A global pandemic that we are living through. This is history we are living through, and we are at the front lines as caregivers. 1 year later, over 500,000 US residents have died. So that was from the 2021 statistics. So we're at 757,000 as of my Googling it last night. There are long-term impacts on both physical and mental health predicted by the American Psychological Association. Some of these include the key findings of the survey. A majority of adults, oh, I can't read my slide. There we go. A majority of adults, 61%, reported experiencing undesired weight changes since the start of the pandemic, with more than 2 in 5, or 42%, saying they gained more weight than they intended. Of this group, adults reported gaining an average of 29 pounds, with a typical gain of 15 pounds, which is the median. So this is a tremendous amount of weight, and we understand the implications of that kind of weight gain for health in general, and especially for being at risk with some of the illness that's part of this pandemic. Two in 3 Americans, or 67%, said they are sleeping more or less than they wanted to since the pandemic started. Similar proportions reported less and more sleep than desired. Nearly 1 in 4 adults, 23%, reported drinking more alcohol to cope with their stress during the coronavirus pandemic. Nearly half of Americans said they delayed or canceled healthcare services since the pandemic started. And nearly half of parents said the level of stress in their life has increased compared with before the pandemic. More than 3 in 5 parents with children who are still home for remote learning, 62%, said the same. Essential workers were more than twice as likely as those who were not to have received treatment from a mental health professional and to have been diagnosed with a mental health disorder since the coronavirus pandemic started. Black Americans were most likely to report feelings of concern about the future. More than half said they feel uneasy about adjusting to in-person interaction once the pandemic ends. 57% versus 51% of Asian Americans, 50% of Hispanic, and 40% of white. Gen Z adults, 46%, were the most likely generation to say that their mental health has worsened compared with before the pandemic, followed by Xers, millennials, boomers, and older adults. And here's the snapshot. Average reported stress in the prior month was higher than it was in 2020. 84% of adults reported at least one emotion associated with prolonged stress in the prior 2 weeks. Most common were anxiety, sadness, and anger. 67% reported being overwhelmed by the issues facing America. Regardless of political affiliation, the majority of Americans reported emotions associated with stress. 85% of Democrats, 83% of Republicans, and 83% of independents. So just looking at the data a little bit differently, this is the data around weight gain or weight loss, and looking at it in terms of amount of weight and population. So some incredibly large amounts of weight, some weight gain and some weight loss here, but this profound shifts in people's overall health and relationship with food. And for a different visual representation of parents' mental physical health impacted since start of pandemic, 75% saying they could have used more emotional support than they received, 32% receiving treatment from a mental health professional, and 24% who were diagnosed with a mental health disorder since the pandemic started. Mothers more likely than fathers to say their mental health has worsened compared with before the pandemic, but fathers are more likely to report behavioral or physical changes. That can be weight or alcohol to cope with stress. And it's really important to acknowledge as we talk about this, that we are represented in these groups, so that there are psychologist parents who are in these groups and experiencing these. 1 in 4 essential workers diagnosed with mental health disorders since the start of the pandemic, 75% saying they could have used more emotional support than they received, and 34% receiving treatment from a mental health professional. And we're almost a year past this now. And so, the data is starting to be collected for the 2022 the January 2022 report. So this has been even more prolonged at this point. Black adults most likely to report concern about the future. I do not feel comfortable going back to living life like I used to before the pandemic, and I feel uneasy about adjusting to in-person interaction once the pandemic ends. So again, even more of a stress load. So Sahar Youssef, who I mentioned earlier, who is at UC Berkeley, a neuroscientist there, and she also, her website is Becoming Superhuman. She does a lot of consulting to the business world. But her statistics that came out of the Asana Anatomy of Work Index in 2021 were that 46% of workers, and these are not psychologists, these are across the board workers, 46% workers feeling overworked, 32% of workers are not switching off or disconnecting from work at the end of the day or on weekends, and 29% have a lack of clarity regarding tasks or roles. All right, and we'll just take a moment to check in again. That was a lot of data. And notice if there were any changes in the breath, retention, the emotional tone, your thoughts, and your energy. So the impact on psychologists and behavioral health workers, more specifically, increased workload demands, the term that we've now seen again and again, the tsunami of need, and the increased isolation. And again, maybe not true for everybody. Some people are working in homes where they wish they were isolated because their whole family's around. Other folks are working in homes where they're alone, or maybe they're working in an office where they're alone. But I know I do some of both. I work from my home and I come into my office to work sometimes, but I very rarely run into my office colleagues because we're coming in and sitting in our offices and doing our video sessions and then leaving and not spending a lot of time hanging out in the hallways or kitchen with each other. And in part because if we were to, we'd have to be masked, and that's not all that approachable. So there are, and even if we are in connection, there is a certain amount of isolation, and that we are masked and we can't interact with the ease of the ways that we used to interact with each other. All right, some headlines. Therapists are under strain in COVID-19 era, counseling clients on trauma they're also experiencing themselves. I'm a therapist and I'm struggling with the COVID-19 pandemic too, Huffington Post. We need to talk about another pandemic, the mental health crisis, therapist burnout. Mental health professionals are the ones taking care of us. Who's taking care of them? And we are therapists. After 6 months of lockdown, we're almost at a breaking point. And then there's the other article I mentioned previously, specific to the issue of burnout for clinicians of color. So we're going to pause again and just take a moment here to list some of our own individual work-related stressors. So I invite you to take a minute to list your top 3 work-related stressors. And then take a moment to list your top 3 personal life stressors. So in part, I ask you to do this to start again, to continue to foster the self-awareness that we're working on, that's embedded in this workshop throughout the time that we have together, because it's such a useful tool in self-care to build that awareness, but also to highlight this sense of there's professional stress and there's personal stress. So we are the statistics in that APA survey, as well as being professionals. So there's ways in which there are multiple burdens that are being carried. And that's not to ignore the satisfactions, the compassion satisfaction, but there are real challenges to this. And we don't get a break from the personal life. In fact, most of the people that I work with, other psychologists and healthcare providers and mental health clinicians that I work with, almost seem to have a common experience of feeling like there's more personal stress also in the last 18 months. And that may in part be because they're that individual in their family who is the go-to for asking for support. And because we're just seeing the toll of the economic demands of this time, the restrictions from healthcare, all of the things that can cumulatively create personal life stressors. So these stressors are really real and they're important to acknowledge. All right. Some burnout experiences. So many people experiencing burnout will report difficulty concentrating or focusing on details, gaps in memory, missing essential details, trouble sleeping or staying asleep, outbursts of anger or irritability, becoming more impatient with clients, feeling more detached, emotionally numb, or flat. Thoughts of, I've heard this all before, or let's get this over with. After a few minutes, you stop listening to some clients. Distrusting your ability to be helpful. Finding it difficult to shut off work. Withdrawing from activities, friends you once enjoyed. Intrusive, involuntary, unwanted images. Thoughts or sudden memories associated with cases. Distressing dreams. Emotional or physical reactions triggered by reminders of case experiences. Avoidance of thoughts, feelings, people, environments associated with trauma cases. Avoidance of conversations, activities, or situations that carry reminders. Dreading seeing certain clients. Elevated arousal, hypervigilant, easily startled, or jumpy. So these come out of Norcross and Vandenboss's book, Leaving It at the Office. It's actually 2018, that's a typo. And these are commonly found and documented burnout experiences specific to psychologists or behavioral health clinicians. And then out of Liesl Bryant's work, if any of you had the opportunity to participate in her presentation for the Trust on Self-Care, which is a two-part presentation that she did this last summer. She is a friend and colleague from New Hampshire and did a just outstanding job in her training on tending to the self. Some of the myths that, and she also draws on the Norcross and Vandenboss book, Leaving It at the Office. Nobody else is stressed or overly impacted by their work. So common myth by psychologist or behavioral health provider. It's part of the job. I just need to push through it or forget about it. If I let others know how stressed I am or that I am experiencing symptoms of burnout, compassion fatigue, or vicarious traumatization, they will question my competence to do my work. I should be able to handle this. There must be something wrong with me that I'm so stressed, overwhelmed, exhausted, and or unfeeling, right? We're supposed to be so feeling and compassionate and empathic. I've just had a few hard cases. This will pass. I don't need to worry about it. And then some truths. You are not alone. Everyone is dealing with numerous stressors. Many of us are burned out and or experiencing symptoms of compassion fatigue or vicarious traumatization. Stress is not something that can be avoided. You are not doing anything wrong, and it is not your fault. We cannot expect to do the work we do as psychologists and not experience some form of stress, especially in this time. We are not stressed because we are weak. Stress is a byproduct of the care-intensive work that we do. And then this from Aubrey and Gentry, the inability for professionals to recognize, accept, and admit the fact that we are wounded by our work is due to a lack of understanding that these symptoms are normal. And I don't know about any or all of you. Maybe I know about some of you because I think some of you attended graduate school with me. We didn't talk about this. We didn't ever talk about this. We didn't talk about the fact that we may be wounded. We didn't talk about the fact that there needed to be some resilience. We talked about boundaries. We talked about assertiveness. But we didn't necessarily talk, at least in my training, and this is, I think, very much changing in training of upcoming professionals, but we didn't talk about this a lot. In fact, in my search to find chairs for my dissertation, when they found out I wanted to research and talk about doing a quantitative and qualitative study of psychologists who treat other psychologists, not very many people really wanted to do that. Not a lot of fighting over being on my chair or chairing my committee, because there was, I think, a little bit of a, oh, we don't want to talk about that. It's not about us. It's about the clients. It's not about us. Well, it is about us. It's a relationship. We do relational work. All right. So how do we address these wounds and acknowledge and address the wounds? Mindfulness, self-compassion, community. So that we're going to shift in some of these directions. I want to talk about compassion in somewhat maybe of a more detailed way than maybe you're accustomed to, or maybe you've done some of this work. And this comes out of a talk that Kelly McGonigal, who wrote The Upside of Stress and The Joy of Movement, and what's her other book, The Willpower Instinct. She's out of Stanford, and she gave this talk on the neuroscience of compassion for the Awake Network Summit on self-compassion for psychotherapists. And it was a really excellent talk. So I draw heavily on that talk in the information I'm going to give you currently. And if people have questions about that, in my self-care, I will acknowledge one of the things I did not do for this workshop was an extensive reference list because I didn't have the bandwidth or time to do it. But I am more than happy to point you in the direction of any and all of my resources and references. I have them, you see them here. I just didn't compile a big separate list for you. But if there's something you're particularly interested in, please don't hesitate to ask me and let me know. All right, so Kelly McGonigal, who again is a psychologist out of Stanford, talks about two forms of compassion. One, it's a motivation or a value, a commitment to reducing suffering in the world, preventing unnecessary suffering, when it can't be avoided, helping those that are suffering experience hope, joy, meaning, and connection, even in the presence of that suffering, an orientation to life, and something that psychologists tend to hold as a value and an orientation to life. And in the last 18 months, we can look very much to that we aren't reducing as much or preventing as much, but likely of helping those when suffering cannot necessarily be avoided. But the other form is more scientific, a coordinated response in the brain and in the body that reflects that value when you meet suffering. So a coordinated response in the brain and in the body. And if we go back to those slides from the very beginning of the presentation, we saw the coordinated response in the body that happened under stress. We saw the activation, except for digestion, that got toned down. We saw what was happening as those signals got sent from the amygdala to the hippocampus and releasing ultimately the cortisol and all the stress hormones. So there's also a coordinated response in the body when compassion occurs, much like when stress occurs. There are changes in the brain activity when you become aware of suffering. Our heart rate changes, our breathing changes when we become aware of suffering. And this is something that has been so interesting to watch as we do our work online. I don't know if any of you have had that same experience of sitting forward in your seat to a computer screen, right? It's very different than when we're sitting forward in our seats in our offices to engage with somebody because they've just told us something that has elicited compassion and they've shared suffering. There are emotions that you feel about someone's suffering. There are beliefs you have about your capacity to relieve that suffering, respond to it, and bring hope to the individual. There is the response, so the belief about it, and then the actual response. The after effects of a response, perhaps a warm glow, feeling connected to your values, feeling that like, I did a good job. And then stress embedded in it, like stress, it's embedded in our biology. So we have a hard wiring for compassion. Compassion is an instinct, and this is again McGonigal's work, developed to help us respond to life's challenges. There are competing instincts that happen that may be elicited instead of compassion, and these tend to be self-protected. Protection, avoidance or escape can be elicited, anger can be elicited, outrage, disgust, judgment, blame, shame, especially in our own suffering. And so we may not immediately go to compassion in meeting suffering. Forms of suffering that we can approach and others that connect to fear and may overwhelm us and pull us away from compassion. So there may be, something that has a personal trigger and it's really hard to approach that with compassion. And we're more likely to move into fear or avoidance or distancing. And sometimes that can help us explain reactions in certain situations to certain clients. I want to go back. So one of the reasons why we look at this is, compassion can result in overwhelm if it shifts into, well, let me say that differently. It's not the compassion. Suffering can result in overwhelm, or it can result in compassion. And if there's something about the suffering that elicits a self-protective response like fear or anger, it's going to be a very different response than if compassion can be elicited. And one of the ways that McGonigal describes it, and I'm looking to my notes because when I planned this presentation, I was using the presenter view, not realizing I wouldn't be able to use it when I was speaking because I'm sharing my screen with you. So that's just what I'm looking to. So she talks about compassion as a subway line, and you can get off at the wrong stop. So that may be, oh, I got overwhelmed. I got off at the wrong stop. But you can get back on the train of compassion so you can start to move toward responding versus to overwhelm or collapse. And we do that by learning to strengthen the compassion response. And that allows us to engage with suffering differently. And I would venture to gain that most of us over the course of the last 20 months or so have gotten off at the wrong stop. we have hit a wall with our capacity to hold the compassion, or something in our day or in our week, those 1,000 paper cuts, or maybe a trauma or a personal stress happening in our lives or our family's lives, makes us unable to access the compassion in that moment, but makes us instead move into protect mode, into shutdown mode, because it's just too much. And so understanding that some of the strategies we'll be talking about as we move forward are going to help us be able to strengthen the compassion response and quiet the overwhelm response. But also, in saying that, understanding that we're humans and sometimes we are going to go into overwhelm, and we have to hold that with compassion for ourselves. Okay. Body changes in compassion. We saw the slide for body changes in stress. Maybe someday there'll be one for body changes in compassion. There isn't yet, at least not one that I found. But when you are connected to compassion, and this again comes out of the talk McGonigal gave for that summit, there are changes in the pitch and timbre of your voice. There are changes in the expression on your face. There are changes in the brain's capacity to understand client facial expression and read them with more wisdom and empathy. There are changes in body language and gestures, and it can't be faked. So, when they talked about when we first went on to Epic and doing electric record keeping in sessions, and they would coach physicians to look up from the screen instead of just writing your notes all the time, there was a real difference between people that were actually having empathy instead of doing the cued look up every 5 minutes and then go back to your notes, right? You can't fake this stuff. You have to really, it's mirror neurons that are responding to each other. So ideally, compassion co-regulates the physiology of the other, and they start to regulate. So you may move forward, the timbre of your voice changes, your facial expression changes, and that starts to co-regulate the physiology of the other. So this is object relations. This is the interrelational space, and they start to regulate. Their breath may start to meet yours. They start to soften. It activates their social engagement system, and they become less afraid of sharing and less vulnerable. They, in McGonigal's words, catch hope. So there is that piece of, I can't change the suffering, but I can give you some hope. The recipient feels more hope and can imagine a more positive future. And the changes in each body are synchronized. So we are very much involved in this process. And because of that, it's important to know that in therapy, some people will respond to this co-regulation as threatening, right? Many of our trauma patients. And it can cause distress, shutdown, and pull away responses. Because it's too much. It's scary to feel that your system's being regulated and co-regulating with another person. And so sometimes if you're seeing this in someone, you are being compassionate, that has just caused overwhelm in them, probably empathic distress and overwhelm in them. But also, I think there's a note I have here around, and this is where I wish we were in a room and could all talk, because it's probably prohibitive to just go into the chat, but if people want to share experiences, you can. We had those moments earlier on in the pandemic where people would ask us more about ourselves. How are you doing? And I talked about this in my peer consultation. I talked about it with clients. I've talked about it. I've seen, comments on listservs. But there could be this like this disconnect of, and I think in part it was somebody was receiving, we are not used to receiving the compassion in our sessions, but we were receiving compassion from our clients in our sessions. And then those moments now as we move on, and maybe we have a cough and somebody is very aware or vigilant to are you okay? So the kind of things that we've developed to say to people of, I'm safe, or I'm healthy, or I have allergies, or whatever it may be. So this can go both ways in this relationship. Let's see. So compassion here is not, I feel bad for you. It is, I have hope that you can find meaning, hope, joy, Hope is embedded in it. It's very interpersonal. So distinguishing just a little bit from empathy, being able to understand, relate to, or share in another person's experiences. It can be a positive state. So empathic joy can be felt, feeling happiness for another. Imagining what they're thinking and feeling. And then starting to share in that, actually feeling it in your own body, feeling it yourself. So again, we see a little bit of co-regulation. There's cognitive empathy, the thinking about what that must feel like for them. And then there's the embodied empathy of the more emotional feeling in your own body, their excitement or their grief. And it can be useful for compassion, and it also can derail compassion. So how we distinguish between compassion fatigue versus empathic distress. Empathic distress is being overwhelmed by your own feelings of suffering regarding the suffering of others. So being overwhelmed by your own feelings of suffering regarding the suffering of others. Feelings can include hopelessness, despair, and overwhelm. And empathic distress can activate the avoidance system. There can be decreased energy to respond, decreased courage, the approach hormones, a disgust response. So there have been studies that have shown some physicians who report touch avoidance with certain patients. And the brain and body are trying to protect you by distancing you from suffering. So there's, again, this self-protective aspects of our bodies that says, I can't go there. So this avoid instinct can kick in when we don't know how to hold the intensity of the shared suffering. It's overwhelming in its intensity. And what we do in compassion is learn what to do to center yourself in intense empathy and to transition to a place of courage. So this is the getting back on the train and being able to notice the overwhelm and then stay in self-aware connection with the other person and with your own suffering. And doing so with mindfulness, keeping a wise perspective in the moment to create some distance so that you can observe what's happening, but not avoidant distance. So it's learning to not push away and like, the disgust or the don't want to touch, but like, I'm going to create one of my favorites in those kind of boundaries, or the clear plexiglass screen of, okay, I'm just going to put this here. So I have some distance, it can't come at me, but I still can see and I can be seen. So the perspective is, this is not my suffering, being able to distinguish from what you're feeling internally, but knowing it's not your suffering, and the empathy. Too much empathy, there's a lack of activation in parts of the brain that creates a boundary, a self-other distinction. And that's been seen on fMRI. But in practicing compassion training, you can learn to activate that area of the brain and be more boundaried. So you can hold the empathy with the person without going into overwhelm, because you're able to create more of a self-other distinction. And they've also shown that for folks with too little empathy, there's a lack of activation in those areas. So it's about regulating some of those areas. And the tools utilized in some of these studies were self-compassion practices. Okay. Compassion fatigue and empathic distress. So compassion fatigue is what arises when you're fully in the role and process of compassion, but for any number of reasons, you're not getting the energy back that you need to continue to engage with the suffering in a healthy and sustainable way, where the suffering is out of proportion to what you can bring to the moment. So that's different than empathic distress. It's about resources. It's not about not being able to hold empathy or being overly reactive to what you're experiencing. Being in a role that actively creates more suffering, making a difference, but the system is not supporting you. Not being supported is exhausting. So I work with some nurses as well, and this has very much been their experience in treating people in the hospital, especially people with COVID and especially with Delta variant, as we've moved into treating people that are unvaccinated with COVID. And I think that can be true in our own attunement with somebody based on our values or based on our beliefs, and that can be a challenge to the resources. Seeing people who seem to be actively creating suffering, one becomes cut off from the belief that people are inherently good. And what nourishes you from being able to sustain compassion is not refueling you. So these are the ingredients of compassion fatigue: not having the resources and not being refueled to be able to sustain the compassion. So figuring out how to find a support system versus dealing with the distress. Dealing with the distress may be more about empathy. Finding supports is more about how to be able to maintain compassion. And they're both really important in doing what we do. And sometimes that can involve moral elevation versus moral outrage. That can be another one of our protective factors, or our self-protective go into outrage, which can be part of judgment, right? All right. So McGonigal again talks about the compassion instinct being adapted to witnessing suffering outside of the self. So there's all of these body responses that happen when we see suffering in another person. It's embedded in the neurobiology and in our hormones. It's about being in relationship with, so an object relations in my perspective. When the suffering is yours and you're in the middle of it, it is hard to activate the instinct that requires feeling in relationship to the one who is suffering from a position of being able to respond. We don't see ourselves to be able to lean forward and change our tone because we're in ourselves. So the basic challenge to self-compassion and that coordinated mind-body response is that it's adapted to witnessing suffering outside of yourself, not to witnessing your own suffering. And it's challenging to witness our own suffering. And I would say that's probably even more the case in the caregiver, in that we tend to be more other focused than self-focused. So self-witnessing is hard anyway. Self-witnessing our suffering is incredibly hard. So we tend to respond when, and this is to suffering, when we are resourced, strong, and hopeful. And then we can approach suffering. We often don't approach suffering when we don't feel resourced or strong. But when the suffering is yours and you're standing in the suffering, you're not in your strength. So the instincts that are more powerfully activated in that moment are sadness or grief, depression, shame, or self-criticism. Self-compassion requires creating a relationship to the one who is suffering. So, if we go back here to these other instincts that are activated, that's a big piece of why it can be hard to tend to ourselves in these moments, because we may just go into judgment and back to those myths that we talked about a little while ago of what's wrong with me? Why am I being so unfeeling? Or other people don't struggle with this. There's more judgment or shame than there is compassion, because we're not used to tending to self, and we're not witnessing those cues that we would witness of suffering in another. So I want to talk a little bit about self-compassion and, Kristin Neff and Christopher Germer's definition of self-compassion, and then into how we start to create some of this compassion for ourselves in terms of our own self-care. But I'm looking at the time. Where are we? It's about 2:30. Are people ready for another 5-minute break or so? Yeah, I'm seeing some nods. Okay. Let's do a break. It is 2:34. Let's come back at 2:40. Does that make sense? Okay. In or around then. Come back. So many people are familiar with Chris Germer and Kristin Neff's work on self-compassion. It's received a lot of attention and kind of being considered in one of the new waves of psychotherapy intervention. And they do such a beautiful job at what they do. So they define compassion or self-compassion as compassion turned inward, treating the self with care and concern when confronted with personal inadequacies, mistakes, failures, and challenging or painful life circumstances. In three components or three aspects that they identify: self-kindness rather than self-judgment, common humanity rather than isolation, and mindfulness rather than over-identification. Self-compassion is found to be a robust resilience factor when faced with feelings of personal inadequacy. It affords greater emotional resilience and increased personal responsibility for one's health, lifestyle choices, failures, and shortcomings. It's consistently associated with lower levels of depression and anxiety. And individuals with high self-compassion are less likely to ruminate on their negative thoughts, emotions, or to suppress them. So multiple studies reveal links between self-compassion and happiness, optimism, wisdom, curiosity, and exploration, and personal initiative. There's a misconception that self-compassion may lead or would lead to self-indulgence. Rather, the research suggests it enhances motivation. There's more motivation to change for the better, trying harder to learn and avoid past mistakes, motivating health-related behaviors such as starting a diet, stopping smoking, beginning a fitness routine. And self-compassion is negatively associated with maladaptive perfectionism. Gilbert and Proctor indicate in their study that self-compassion provides emotional resilience because it deactivates the threat system and activates the caregiving system. And we'll talk more about the caregiving system in a little while. Self-compassion is considered to be a skill that can be taught. Germer and Neff in 2013 defined self-compassion as being related to psychological flourishing and reduced psychopathology, including anxiety and depression. It facilitates resilience by moderating our reactions to negative events. Self-compassion does not push negative emotions away in an aversive manner, nor does it replace negative feelings with positive ones. Rather, positive emotions are generated by embracing the negative ones. So this is not a cognitive restructuring, it's a different skill set. It's sitting with the emotion or alongside the emotion that then allows it to start to shift and transition. In Erickson's et al.'s study of 2018, a randomized controlled study of 101 psychologists, 51 in a self-compassion training group and 49 in a waitlist control group, the self-compassion training was 15 minutes per day, 6 days a week for 6 weeks. The levels of perceived stress and burnout symptoms were lowered in those practicing self-compassion. So in that period of time, there were noticeable significant changes. Neff et al. In 2020 showed 2 studies examining the efficacy of the Self-Compassion for Healthcare Communities program for enhancing well-being and reducing burnout among healthcare professionals. The first study, Self-Compassion for Healthcare Communities, significantly increased self-compassion and well-being, and all gains were maintained for a 3-month period of time. In the second study, in addition to enhancing well-being, the self-compassion for healthcare communities significantly reduced secondary traumatic stress and burnout. So shifting a little bit, as we started at the beginning in my acknowledgements, I didn't just do a land acknowledgement, I did an acknowledgement to the yogic traditions, and I've had a long-standing yoga practice that I started after my first year of graduate studies because of the disconnect between body-mind and what was happening and needing some strategies for self. And eventually received my own yoga teacher training and have done a fair amount of teaching more workshop and retreat teaching and teaching the neuroanatomy of yoga to yoga teachers, trainees, than studio yoga classes. But I wanted to insert a little bit from the yoga tradition to recognize that Neff and Germer's work is phenomenal, and yet some of these concepts date way, way back to anywhere between the 2nd and 5th century BCE. The sutras, Patanjali's Yoga Sutras, are identified for around that time. And the Sutra 1.33, called The Keys to Peace, says, I have the Sanskrit here for you if you're interested in those things, by cultivating attitudes of friendliness toward the happy, compassion for the unhappy, delight in the virtuous, and disregard toward the wicked, the mind stuff retains its undisturbed calmness. So this is the key to peace: having compassion, having delight in the virtuous, disregard towards the wicked. And this is described as the 4 keys and the 4 locks sometimes, and doing loving kindness and benevolence towards others, having compassion towards those that are suffering, sharing in sympathetic joy towards those that are happy, and having equanimity for those who may be causing suffering, for those that we tend to struggle with. And these practices are thought to bring us to a sense of peace, which is ultimately what Neff and Germer are finding in their work on self-compassion. So ways to cultivate self-to-self relationships for self-compassion. So if self-compassion is so important and such a key to reducing burnout and regulating distress, and yet if it's very hard without going through Germer and Neff's training for us to cultivate self-compassion and learn to do that for ourselves, because we're not witnessing our own compassion and we can't respond in those ways with those cues of facial expressions and different timbres to our voice tone, then how do we start to cultivate self-to-self relationship so that we can express compassion to our own selves? So there's some strategies that are recommended. Creating a wise witnessing self through mindfulness. So starting to either through a mindfulness meditation practice or through different ways of getting that observer state, starting to be able to witness self, having that self-awareness, which we've been practicing today. It doesn't have to be too fancy or complicated. Touch, sensing the self as the one touching and the one receiving touch can create a self-to-self relationship that can activate the compassion instinct and can ensure a coordinated mind-body response. So the teaching here is often to take your own hand and place it on your heart. Sometimes it can be to touch the side of your cheek. And these are very simple things that we can do even in between our clients to start to craft a self-to-self relationship of, oh, I love you, or, oh, that was hard, to kind of, I'm being tender with myself, to create that touch sensation that starts to calibrate the body response that we want to be able to be compassionate. Also talking to the self in the second person. So alongside that touch, it may be, Maura, I know this is really hard. So touching and speaking to yourself in that second person voice to start to trigger those reactions in the brain to elicit compassion. And these are ways of building that compassion response so that we're more likely to stand in compassion and less likely to go into the overwhelm. And that is all self-oriented, which is all wonderful, well and good. But moving into that third strategy, so we had mindfulness, compassion, and community, it's also incredibly important to understand that you are deserving and worthy of compassion by asking for help. You don't have to give it all to yourself. Allowing yourself to receive the compassion of others and trust that others will be there for you. So looking for the compassion that is available to you and not just relying on self-compassion. That can be a really essential piece of this work. This can be especially difficult for psychologists and caregivers who tend to be other versus self-oriented and to have difficulty seeking help and asking for their own needs to be met. And so some of the themes that come up very often in working with psychotherapy clients are how do I ask for my own needs to be met? How do I even recognize my needs sometimes? Because we're so accustomed to the overdeveloped focus on other, which can lead, not always, but can lead to an underdeveloped sense of self needs. So I said we would talk more about caring and the caring response. This is from Kelly McGonigal's work on the upside of stress. Caring for others triggers the biology of courage and creates hope. So here we see hope again as one of the factors that can offset suffering and improve self-care and resilience. So I want to talk a little bit about the caregiving instinct, because essentially we are caregiving throughout our days. And this is part of compassion satisfaction. This is what makes our jobs great and gives us a leg up. So it's not all bad news. Yes, there are some of these things that are challenges, but there are also these things that are very wonderful aspects of what we do and give us that compassion satisfaction. Seeing a loved one in pain or a client in pain, it can activate an instinct that overwhelms your fear and allows you to rise to the challenge. So we all have those stories of the mother who lifts the car off the child, right? A little bit of that type of mindset. Caregiving has to embolden us to overcome avoidance, fear, and despair. So walking into that office and overcoming those things. And I remember early graduate training days, people would be like, what do I do? What do I say? There's a lot of avoidance fear that we have to learn to tolerate to craft our skills and develop as clinicians. So caregiving activates hormones that are connected to courage and approach motivation. So oxytocin, the hormone that helps us connect with others, dampens down our fear circuitry and activates our reward circuitry. So when we did that list of, how have I been changed for the better in my work? Well, good news, your oxytocin system has been activated, and that's reward. And it dampens down fear. Dopamine, pleasure, motivation, tells you to approach versus to avoid, makes you believe something good is possible, empowers the motor system, movement in your body to be able to move towards, to connect. And another tool in the body, vasopressin, which is that protective, fierce compassion. So maybe elicited less in our work, although sometimes it may be, especially if we work with certain populations or kids and in areas of passion. But this may be more of the actual neurobiology that's involved in the mother lifting the car off the baby. It's that fierce maternal or paternal, but that fierce type of compassion. So all of that allows us to engage and to approach, and those are benefits. Those are resilience factors of caregiving. Joseph Quaglia, who also spoke at the Self-Compassion Psychotherapy for Psychotherapists Summit, talks about balanced compassion. And this is a concept that I have found very, very useful in the work that I'm doing with other providers and for myself, and when I'm trying to approach self-compassion. So Quaglia talks about the fact that self-compassion versus other-oriented compassion is a modern distinction, that we didn't always distinguish between these things. There was just compassion. And that it may be important in moments to ask whose suffering are we oriented towards? The suffering of the self or other? Or what if the suffering is shared? There can be permeability of the self-other boundary within suffering. And Quaglia asks for us to consider, as a therapist, trying to discern which is easier, orienting to our own suffering or other suffering. And you can ask yourself that for a moment. Most therapists will say it's easier to orient to other than it is to orient to self, or that's the automatic, especially in the workplace when we're in our frame of our office. That's our task. But it's important to flexibly move between or oscillate between self and other oriented compassion, so that compassion can be for every person having the experience. So what would this look like? It may be that in the moment, as you're learning something, as you're witnessing suffering, and your compassion system is activated, and all of the things that we talked about that happen within that start to occur. The timbre of your voice changes, your facial expression changes, you start to notice that person's compassion, you approach and move toward it, and you notice them. But then you also can shift the lens, and maybe there's a light touch, but you also think, oh, as I'm noticing I'm starting to suffer because of their suffering, I'm having some empathic reaction to their suffering, or this is a hard story for me to hear. And then you move back and look at, and you focus again on their suffering. That's where the majority of it lies, but you don't leave yourself out of the equation. You come back to, this is triggering something in me, or I'm just reacting to this story, or I'm noticing, oh, the sensation in my gut. You can move and oscillate between other and self. And so within that, I believe there are opportunities to not build up as much of the stress throughout the day, because you don't have to then look back, or you don't miss opportunities to finish the stress cycle, because you noticed your own distress at what may be personally shared with you in that moment by that client.
Hey, Maura, this is Nathan, your chat moderator. And since questions are kind of rare, one just popped up.
Yeah.
And someone was wondering, I'm wondering if there's research out there, or if you have ideas on how to work with anger/aversion towards the self that is often associated with trying to be tender to oneself.
That's a great question. I don't know of any research per se right now, but so much is happening. And I think the person, it's Paul Gilbert's work, who's in the UK, talks a little bit about this, and especially being able to start to work with somebody in asking them to share their language about how they talk to themselves, and that can really help bring that into the awareness. And I think that there's a piece also within that of starting to, there isn't research about this, but the self-compassion teachings will talk about, have compassion for the fact that it's hard to have compassion for the anger that starts to come up within trying to address self-compassion. And I will say that, it may be as Neff and Germer do more of this work with healthcare communities, they may address this more, because I certainly see that issue more in maybe not so much psychologists and healthcare providers, but physician clients, or clients that hold themselves to this very high standard and have a hard time accessing that self-compassion piece. Did that answer the question? Should we say more about that, or does anybody else want to share with that question?
Feel free to add more questions to the chat, all you viewers.
Yeah, absolutely. It's a really good question. And one of the biggest, I think, dilemmas of accessing self-compassion, it's like, how do you come into that and sit with that without those other, that shame or those other responses coming up? All right, thank you for that question. And please, people feel welcome to ask some questions. I'm just going to check my notes for a second while we see if anything else comes in through the chat. I'm having a hard time accessing the chat, and in part because I don't want to click on stuff and have my screen sharing go off. So if something does come in, if you want to share with me, Nate, that would be great. So just in regards to shifting back a little bit to caregiving, that helping or supporting others can be like a life preserver right now in COVID, when we may be starting to feel despair. It can help us find joy and meaning in our work, but caregiving fatigue can also be really, really real. So we can exhaust that system. We can lose resources for that system as well if it isn't energizing us. So when we're under-resourced, and we may easily kind of create our own suffering, and it can be hard to stay connected to caregiving in those moments. And then it's not as protective as it would be if we're just caregiving without, within feeling resourced. So that's an important thing to gauge of when there's too many caregiving demands, it can move into caregiving exhaustion. And that can certainly happen when you're doing that within your workday, and then maybe something in the personal life happens, and that's where it just becomes overwhelming or too much. All right. So all of this is to say that we can become much more self-aware if we develop self-compassion, and at the same time, it will benefit us with reduced anxiety and depression, increased clarity and perception, decreased reactivity so that we can reduce that enlarged amygdala from so much stress. All right. Wellfill states, psychotherapy requires a delicate balance between being open to the client's pain while preserving some self-protecting distance. So it's that just right balance of being present and being able to respond to the suffering, but being distant enough that there's a little bit of self-protection. So where are we with time? So I was planning on and will be guiding a self-compassion practice at this point. I'm just trying to think about time parameters. It's hard to gauge how much time things may be taking, but it looks like we aren't getting a whole lot of questions. So I do want to leave some time for questions at the end of the presentation, but we'll move into this practice, and think about it, that it'll be about a 10, maybe 15-minute practice. So I encourage all of you to engage with it, but also take care and tend to yourself. So if this is a time where what you would really benefit from for a part of it is to move and stretch, stay in the beginning. There'll be opportunities then to shift away, and then we'll call back, but don't just go wander off for a while. So I want people to experience a little bit of that, the practice of self-compassion and what was being talked about in that sutra of the 4 locks and the 4 keys around loving kindness. And this is a very commonly utilized meditation. It's utilized in the mindfulness stress reduction program. It's also used within self-compassion. So I'm going to guide you through this. You are welcome to attend to some of the cues, ignore the ones that don't support you. This is your practice. So we're going to coach a posture of compassion, and then we'll move into the meditation. So I ask you again to find your seat and connect with being supported by the land. So first, you may notice where your body comes into contact with your chair or couch. Maybe you've moved to the floor. And notice that that piece of furniture or that floor sits on top of a structure that ultimately sits on top of the land, that roots deep, deep down through bedrock into our earth. Feeling connected and supported by the earth, and knowing you are a part of it. You're welcome to keep a soft gaze to the tip of the nose, or if you're comfortable, close your eyes. And just start by taking 3 breaths, inhaling through the nose and exhaling out an audible sigh. Inhale. Exhale, release. Perhaps this last time, putting that hand to the heart, inhaling through the nose and exhaling, audible sigh. Maintaining that sensation of the hand on the heart, begin to invite the breath to expand as you inhale, noticing that sense of expansiveness, and noticing the expansiveness giving way as you exhale. Noticing again the quality of the expansion on the in-breath and the expansion dissolving on the out-breath. Let yourself receive and release the breath. And now bringing awareness to that hand and the heart space, and trying to imagine the breath originating from the actual heart. Breath expands as you breathe in and dissolves as you breathe out. Breathing directly into your heart and chest. Inviting energy into your heart. And maintaining the hand or dropping it onto the lap, whatever is more comfortable for you. Taking a moment now and imagining a benevolent one, a beloved. This might be a partner, a child, an animal, an imagined being. But imagine that person that just brings you, or being, or entity that gives you joy, expansion in the heart. And as you focus on that image or that thought of that person, perhaps the sensation of hugging them or sharing a cup of tea with them, petting them. As you hold on to that image or sensation, send these thoughts. May you be happy and contented. May you be safe and protected. May you be healthy and strong. May your life unfold with ease. May you be happy and contented. May you be safe and protected. May you be healthy and strong. May your life unfold with ease. And going back to that image sensation and maintaining that same energy in your heart, expanding on the in-breath, dissolving on the out-breath, and sending those words to self. May I be happy and contented. May I be safe and protected. May I be healthy and strong. May my life unfold with ease. And if it's challenging, returning to that benevolent one, that beloved, or oscillating from the beloved to the self, expanding in breath, dissolving out breath. May I be happy and contented. May I be safe and protected. May I be healthy and strong. May my life unfold with ease. And hand on the heart, breathing through the chest and heart, and taking a moment just to think about those personal and professional stressors you listed, and breathing into them as you observe them and acknowledge them. Expanding on the in-breath, dissolving the out-breath. And taking another breath here, inhaling through the nose, exhaling and sighing again. And begin to direct your attention again to your seat, where you touch the earth, the furniture supporting you, and notice the sounds in the room. The sounds just outside the room in the building you're in. Perhaps the sounds outside of the building you're in. And starting to invite yourself to come back to the space you're in, taking your palms and rubbing them together, creating heat and friction in the palms of your hands. And then placing them over your eyes as you gently open them and come back to this space. Okay. Such a nice reset to connect with self. All right. So we're going to move into more of our practical strategies in defining self-care, the deliberate and self-initiated attempt to take care of oneself. With the time being where it is, I'm going to try to move through this without another break so that we can have a longer break at the end, but we have some activities that take care of yourself always. Self-care is a self-initiated practice of taking an active role in protecting one's being and happiness. Tending to oneself, getting to know oneself. Being aware of and honoring one's own needs. Mindfully paying attention to and caring for oneself. Deliberately acting to promote one's physical, mental, emotional, psychological, and spiritual wellness. This is in part from Liesl Bryant's talk. And Norcross and Vanden Bosch, in this much quoted quote from their book, Leaving at the Office, state, "We must make self-care a priority. Self-care is not a narcissistic luxury to be fulfilled as time permits. It is a human requisite, a clinical necessity, and an ethical imperative. If not us, then who will value our self-care?" The ethical imperative. So principle A of the APA Ethics Code, beneficence and non-malfeasance. Psychologists strive to be aware of the possible effect of their own physical and mental health on their ability to help those with whom they work. Standard 2.01, boundaries of competence. Psychologists provide services, teach and conduct research with populations and in areas only within the boundaries of their competence. Standard 2.03, maintaining competence. Psychologists undertake ongoing efforts to develop and maintain their competence. Standard 2.06, personal problems and conflicts. Psychologists refrain from initiating an activity when they know or should know that there's a substantial likelihood that their personal problems will prevent them from performing their work-related activities in a competent manner. When psychologists become aware of personal problems that may interfere with their performing work-related duties adequately, they take appropriate measures, such as obtaining professional consultation or assistance, and determine whether they should limit, suspend, or terminate their work-related activities. And I think it's really important to notice here that it's determining with consultation, limiting, suspending, or terminating. It's not necessarily having to suspend. I think we panic into thinking sometimes like, what if I can't work? Maybe it's shifting how we work, how often we work, when we work, using more consultation so we feel more resourced and supported in our work. And standard 3.04, avoiding harm. Psychologists take reasonable steps to avoid harming their clients, patients, students, supervisees, research participants, organizational clients, and others with whom they work, and to minimize harm where it is foreseeable and unavoidable. And Barnett et al., also in Bryant's talk, failure to adequately attend to one's own psychological wellness and self-care can place the psychologist at risk for impaired professional functioning. An ongoing focus on self-care is essential for the prevention of burnout and for maintaining one's psychological wellness. There's an ethical mandate that dictates self-care responsibility, as self-care or the lack thereof directly impacts the lives of those we are assigned to help and assist. And there's an ethical responsibility to those we serve to be informed about the stressors we face and to practice self-care that directs itself at minimizing the symptoms of those stressors. Again, from the Professional Affairs Advisory Committee on Colleague Assistance, the 8 benefits of self-care. It's found to reduce the occupational hazards such as burnout and compassion fatigue, helps build resilience, models health behaviors for clients, promotes quality of caring, increases the capacity for empathy, fortifies relationships with clients and others, and enhances self-esteem and confidence. It contributes to realistic goal setting. All right. I want to play, oh, I'm a little nervous about this. We're going to try it. How about we try this? I'm going to have to screen share something else. Okay, we're going to try it. This is a little video put together from an early career psychologist a couple years ago around self-care. Let's see.
Maura, I'm going to put you on hold for a second.
Okay.
If possible, may need to, did you embed this, or is it going to a different link?
I think it may be going to a different link.
Because if it's embedded, there's a setting you had to do at the beginning, otherwise the audio won't work very well.
Okay.
So I'm just putting it out there.
All right, so let's bring my shared window to the front. Are people hearing that or not?
I can hear it, yes. But I'm not seeing it.
Okay. Okay, hold on. I'm working on it. Okay, can people hear me?
Yes.
Okay, I am going, you have the link you'll have the link in your PowerPoint. I will let people watch that on their own because I don't know how it was working. And let me go back to screen share here. Now it won't let me. Why did I try that? Okay, share my screen. Okay, are the slides back up? Can somebody?
Yes.
Okay, thank you. All right, I got too ambitious. You can go watch this video on your own. It's a very sweet video of two different early career psychologists who gave their video of what self-care means to them. And it's a nice, inspiring little video. And it also lets us know that self-care is being addressed more in our current graduate students than perhaps it was in the past. Okay, moving on. Okay, so we're going to talk about, we're going to dive into Norcross and Vanden Boss's book, Leaving It at the Office. It's a 13-chapter book, and essentially each chapter is one of the strategies for self-care. And I'm highlighting those practices for all of you, and some of the information they give as to why these are some of the essential self-care, broad self-care strategies. And then we'll get into a little bit more detailed aspects of self-care, and specifically self-care during times of COVID and remote working. All right. Strategies for self-care. The first broad strategy is valuing the person of the psychotherapist. Okay, the ideal balance of caring for others and for ourselves tends to favor the former. At the risk of redundancy, we believe it begins with prioritizing the value of yourself as a person or psychotherapist.
How much longer?
They talk about self-awareness and self-monitoring. Are you attending to your needs as generously as you attend to those of others? And those are some of the things that we've been kind of actively weaving into our time together today. Building on your self-care strengths. So some of the recommendations that Norcross and Vanden Boss make is to know that you're already doing a lot right, and make sure you pay attention to where your strengths lie. What are you doing right? And instead of starting to feel like you have to create a brand new plan or start all of these new strategies, do a little bit of an assessment around where am I doing pretty well and where are the strengths? Make self-care a priority for yourself. And ask your clients what has been helpful in the therapy so that you can internalize the relational crux of the work. You can get some feedback in appropriate ways that show that you are valuable and that what you're bringing to the relationship is valuable. Our burdens and our satisfactions are communicated to clients and obviously impact therapeutic success. So we are the tool, and if our tool isn't attended to and sharp, then it's not going to be as effective. We offer relationships that heal and strengthen people, but they do so most effectively when we are at our best and when we value ourselves. Okay, refocusing on the rewards. 40% of surveyed behavioral health professionals and psychologists scored high on feeling blessed and low on feeling burdened. So for the most part, there is compassion satisfaction in the work that we're doing. Refocusing on the rewards of practicing helps maintain high satisfaction and reduces work-related distress. No person can help another without helping him or herself. And one of the real practical ways of doing this and managing this strategy is oftentimes with the negativity bias, we will go through our day and think about the one unsuccessful moment, the one challenging client, the difficult session, and not on all of the very many positive aspects of the day. So making a habit of jotting down and keeping a piece of paper at the side of your screen, if you're not doing in-person sessions, that kind of lists what the good things were, list that really good moment, list that kind of moment of shared recognition with the client, or that aha moment, that breakthrough, or just that sense of connection, that sense of meeting compassion and instilling a little bit of hope. Recognizing the hazards. Isolation is a leading complaint of experienced independent practitioners. Emotional isolation, the constant emotional regulation segregates the therapist from others and possibly from her own feelings. So that there is, in attending so much to other, a challenge in being aware of self. And that goes back to the quaglia's oscillation in compassion. And then the hazards of the statistics we saw earlier about the likelihood of 33% or so of having a client suicide, or possible threats or aggression or harassment by a client, that these are all things that can be hazards of the practice and create distress. So in the professional quality of life inventory, contributing to compassion fatigue versus compassion satisfaction. Terminations, there's a lot of loss in what we do, especially if we're successful at what we do. And recognizing that one of the benefits of doing this presentation and being more mindfully attentive and crafting an observer mindset towards these issues, even more so than usual over the last couple of months, is it gave me opportunities to practice some of these things. And I had a long-standing client relocate, and we had to terminate by computer and terminate because they were going to be out of country. And we did our termination session, and then I was very quickly moving on to my next session after the disconnection. And I started to do what I do of take those 5 minutes to attend to self needs or to get ready for the next client. And I paused for a moment and said, wait a second, I haven't closed that stress cycle, or I haven't had compassion for myself. This was one of my first clients in Oregon as a licensed Oregon psychologist after years of being licensed in New Hampshire, and the first people in my practice here, and a dear client who'd done some good work. And so I sat for a moment and I put the hand on my heart and I said, that was a hard goodbye. I really liked her. I'm sad to see her go. That's a loss. And it was maybe 90 seconds, but I really think it helped because it closed that stress cycle of, that little bit of emotion that hadn't been addressed. And it valued myself as a therapist, and it addressed this hazard might be too high, but that there was a loss there in that moment. And then I didn't have to, at the end of the day, that hadn't built up because I'd addressed it in the moment. So that can be a really nice way. And that isn't to say there are many opportunities that I don't take to do that because I'm in the mode, but there are sometimes it's celebrating the moments when you did remember to do it and did it and felt the success of it. And then the other hazards, the system demands, the insurance, the paperwork, definitely we can relate to that in terms of death by 1,000 paper cuts. Okay. The fourth broad domain, minding the body, is so imperative. And if we think of the emotional regulation strategies out of DBT, minding the body, we need sleep, we need movement, we need nutrition and hydration. We need small breaks from movement between our sessions, stretching, self-massage, attending to the actual body, and that our bodies were not meant to sit for so many hours in the day, especially perhaps in settings that weren't originally intended to do the work that we're doing right now as we pivoted to address working from home or remotely during the pandemic, if you did that. Human contact is very essential, and monitoring uses of substances is also, we are part of that statistic of increased weight gain, increased alcohol consumption. So just being aware of what's happening to the body and tending to the body. Nurturing relationships in the office or work sphere, the concept of a competence constellation that I will talk a little bit more about. And away from the office, the highest rated career sustaining behavior for psychotherapists is spending time with a spouse or partner or friends and friendships. So making sure that we are in connection. So that was mindfulness, compassion, connection. The competence constellation. This is defined as a psychologist's network or consortium of individual colleagues, consultation groups, supervisors, and professional association involvements that is deliberately constructed to ensure ongoing multi-source enhancement and assessment of competence. We cannot work alone, especially right now. We need to have input and feedback from our trusted colleagues, and we need support. So competence constellations could be made up of peer consultation, finding through the listserv other people that are looking for peer consultation, or perhaps you have it embedded in your practice site. Finding formal peer consultation that meets regularly and frequently, and that you can access in non-meeting times. Colleague friendships for some of that informal connection, or just knowing that there's somebody that understands what your lived experience is like day to day. Professional organizations, like being a member of OPA, perhaps APA, perhaps other professional organizations related to your specific interests and the work that you're doing. Learning environments, study groups, book groups, and other opportunities to connect around that. The OPA offers us ethics committee consultations that are so invaluable to be able to talk to one of the very wise members of the ethics committee and get some consultation regarding an ethics issue. So why worry about something alone if you can worry about it with another and maybe get some reassurance. I mentioned the confidential peer support committee, of which I'm a member. So we offer consultations again to the OPA community. It can be around all sorts of varied things. You would email or call a committee member. We would schedule a time and get back to you. We then frequently will consult with another member of the committee ourselves and then get back to you just to make sure there may be something that we might have missed in the consultation that we want to share with you, and just to make sure it's happening in community. And we maybe get calls about concern about a colleague, concern about how to handle a retirement, concern about how to handle a puzzling request from a client that doesn't quite fall into an ethical parameter. And we have the protection in that it's completely confidential, even from those I forget the statute, I'd written it down somewhere, around reporting what's considered unprofessional behavior in another professional. We are exempt from that as a peer support committee. And so it's completely confidential without risk. So I encourage you to utilize that research and reach out. Paul Cooney, the attorney through Oregon Psychological Association, or another attorney who offers, Paul offers generously consultations to OPA members, and accessing that. Again, why worry alone if you can't get an expert take on what's going on? And I will say I have utilized all of these resources more in the process of COVID than I ever have before. And it's immensely helped with isolation. The other, if you're a member of the Trust, their risk management consultation team, their 800 consultation does similar 20-minute consultations around an client issue that you may be concerned about, and they are really invaluable. And I will often utilize more than one, talk to my peer consultant, call Paul Cooney, and then call the Trust. And then I have a really nice competence constellation around the issue of concern. So another activity, this is where your paper and markers or colored pencils may come in handy. Some of you may have done this before. I haven't worked with kids in a long time, but I used to work with kids. So you're going to draw your helping hand, and you can actually trace your hand if you have your markers or your pencils or even just a pen, or you can just do a list of who your helping hand is. But in this activity, when we used to work with kids, and remember, creative expression is a way of closing the stress cycle, you can draw your helping hand and then write the names of your supports down. Of who do you tend to turn to for consultation or support? And some of us may not be able to fill out every finger of the hand if you don't have that big a peer consultation network that's not moving into shame or overwhelm, but just saying, oh, that's something I can fix. I can put something on the listserv. I can find some buddy to consult with. I can call the confidential peer support committee. There are things that can be done. I know, as I said, I relocated to Oregon in 2018, and people were very receptive to my reaching out and wanting to find peer consultation. And I was accustomed to New Hampshire's board actually has a requirement for peer consultation hours when you renew your license every 2 years. Not recommending that. We have enough requirements in Oregon, but we had to document 20 hours of peer consultation every cycle. And so it just was kind of an automatic thought that I need to find that peer consultation group. It was one of the first things I established on Cubbing, and it was useful in finding community. Okay, switching gears. Okay, strategy 6, setting boundaries. Self-care demands that we communicate and maintain our boundaries. Saying no in the interest of the patient's treatment and the interest of your effectiveness, defining your role, working under capacity to accommodate for emergencies, family demands, and self-care. I know that feels really indulgent right now, given the tsunami of need, but can be extremely effective to leave that little bit of room for those things we can't anticipate. And especially since many clients are coming back to treatment these days because of the stressors of the pandemic and other events in our world these days. Demanding a good enough income, valuing yourself in that regard, and thinking about true compassion as being boundaried, as Tara Brock, who's another compassion and self-compassion individual, will often talk about. So sometimes we think of, if I'm compassionate, I have to just be all giving. Not at all. True compassion is very boundaried. You have to be able to set limits. Okay. Broad strategy 7, restructuring cognitions. Confronting the ultimate psychotherapy fallacy, quote, I should not have emotional problems. After all, I am a therapist. Yes, you are an expert on human behavior, but you're still nutty at times. This is a quote from Norcross and Vanden Boss's book. So creating realistic expectations for your self-care, avoiding perfectionist tendencies toward eradicating your perfectionism, being aware of absolutist thinking, I must be, and self-monitoring your internal dialogue regarding your performance and your patients with reflection, data, or sharing with an appropriate source. So we come back to where the benefits of peer consultation may be helpful. Sustaining healthy escapes at the office, taking appropriate breaks, utilizing humor, colleague interaction if you have that capacity, and away from the office, days off, vacations, restorative solitude, retreats, and play. So this was written in 2018. We weren't in a pandemic, so a little bit different than what we can access within a pandemic, especially with our OHA regulations around masking, but there are still opportunities. So I want to shift a little bit out of the broad strategies to talking a little bit more about ways of doing this, breaks and sustaining healthy escapes. Sahar Yousef, who I mentioned previously, of UC Berkeley and Becoming Superhuman, talks about the 3M framework for avoiding burnout. And in this framework, that has some evidence base to it, there's a strategy of macro, meso, and micro breaks. And these are breaks from work that happen micro on a daily basis, and they may be minutes, 1 to 2 minutes, where you disconnect fully from your work, perhaps engaging in diaphragmatic breathing, perhaps engaging in a mindfulness activity, perhaps engaging in some form of stretching, drawing, anything that may both complete the stress cycle and completely get you away from work. So checking in at home doesn't count, doing some other task does not count. It's getting out of work or focus mode and into check-in mode or downtime mode, or some way that you're completely psychologically detached from your work. So it's very hard to do when we're in our work environments because we have all of these cognitive associations to work in our work environments. And we'll talk a little bit more about how that's so much more challenging now that our work environments are also often our personal environments. The meso break is weekly, getting 1 to 2 hours. And you may think about, I have weekends off, I have more than 1 to 2 hours. How many of us really have 1 to 2 hours of fully disconnected time away from work? And that doesn't mean taking care of kids or aging parents or, even dogs. It's really disconnecting for 1 to 2 hours weekly. And then the macro break is monthly, a half day to a full day, completely disconnected psychologically from your work. You're not checking your emails. You're not thinking about that client or thinking about that training or thinking about what you want to do. You are somewhere totally unplugged from work. So the challenge here isn't just the time can be challenging as well, but the challenge is to be effective, you have to be psychologically detached from work. And how often are we really truly detached from anything, being that we carry our lives around with us in our cell phones these days? And that is part of why we are not in parasympathetic nearly enough and in sympathetic way too much. Okay. Maintaining mindfulness, mind-body scanning throughout the day. Mindfulness practices, especially for transitions, gratitude, and self-compassion, all of these strategies for connecting to mindfulness. So when I have the check-ins and attending to your breath, to your energy, to your thoughts and focus, to your physical tone and emotional tone, those are turn in mindfulness activities. So can an actual body scan or an example like the self-compassion practice and loving kindness meditation that we did. But it can also be writing a gratitude list. It can be thinking of one positive thing about each session that you had that day. It can be thinking of something you value in yourself. Another interjection from the Yoga Sutras, preventing future suffering. So when we think of mindfulness, these also date way back 2nd to 5th century BCE. In Sanskrit, we call it saksi, or the witnessing self, that witness that can watch us. And the sutra that's relevant is 2.16, preventing future suffering from manifesting. And it's often translated as cultivating a witnessing self through the practice of the 8 limbs of yoga will allow one to experience the suffering moment as temporary and bring the knowledge that it will pass to another moment. Practice over time will allow the witnessing self to make different decisions in the moment in order to prevent future suffering. And this may be true even if the moment is positive, because if we attach to the positive moment and then it's no longer there, then that in and of itself can create suffering. So just witnessing what's occurring and knowing that it will change and shift. Creating a flourishing environment, our physical environments, being intentional about your workspace and attending to an aesthetic in your workspace. And then also thinking of that in terms of support. Can you delegate what you can to create greater freedom and independence? Can you find a biller to do that work if it's something that is challenging for you or you just don't like? Or are there other supports that you can put into place for your management of your schedule and of your practice? I know there was a point at which in my career I realized I'm sadly spending probably more time in my office than I am in my living room at home. Why is my good art at home and this art in my office? Why don't I switch it around so I can look at my pleasing art? Just different ways of tending to the office to be a space that's aesthetic, both to your clients, but also to yourself, that you're spending a fair amount of time there. Okay. Profiting from personal therapy. And we saw the statistics earlier about how beneficial this is, and yet how seldomly psychologists will access this means of support. Personal therapy has been shown to enhance clinical effectiveness. If you select a provider carefully, it can be a key part of your competence constellation, both modeling to you, but also being a support to you in your own self-care and monitoring your level of burnout and satisfaction. Returning to therapy periodically or considering an annual checkup just built in so that you have that in place if you don't feel like you need it on a weekly or bi-monthly basis. And encouraging personal therapy in the field, really normalizing it to clinicians, supervisees, trainees, people that you're in consultation with. When therapists reached out for help from other mental health professionals, the capacity for empathic behavior increased, both directed towards oneself and towards clients. And so perhaps one of the other answers to that earlier question about what if there's anger that's elicited in trying to access self-care, perhaps that's something that can be addressed in some of this work of personal therapy. Cultivating spirituality and mission, identifying and resonating with your calling to be a psychologist, cultivating awe and wonder at the human spirit, connecting to spiritual sources of hope and optimism regarding human behavior. I think especially in these times, this was very challenging a year ago when we were seeing all of these things happen, especially here in Portland. Deepening meaning in your own life, and becoming a citizen therapist by merging your vocation with social activism. So an example of this is the work of Dr. Sarah King, and I don't know her work well, but she came to my attention while I was developing this workshop on two fronts, through a newsletter through OHSU, as she's a postdoctoral fellow in neurology there. And then she also made it on the list of 15 most influential game changers and yogis in the Yoga Journal article that just came out. And Dr. King, again, is a neurology postdoc fellow at OHSU, working on connecting science, yoga, and social justice. And she states, we cannot effectively work towards social justice in our communities without taking care of our hearts, minds, and bodies, and vice versa. Dr. King uses yoga and other somatic and contemplative practices to help people embody a sense of social justice and liberation, and to heal from intergenerational trauma. As a postdoctoral researcher in neurology at Oregon Health Science University, King also studies the impacts of yoga and meditation on perceived discrimination and chronic pain. So somebody that's very much doing this lived integration of citizen psychology and social justice work, and having meaning in the work that she's doing. Not a psychologist, but in the related disciplines and fields. Okay. And finally, for the broad strategies, fostering creativity and growth. Diversify, involvement in diverse professional activities, balance your workload, and express the full array of your skills. Imagine periodically your future possible selves as a psychotherapist, and then set sail in that direction. How do you want to continue to grow and develop? What are your goals? And embracing continuing education as continuous improvement and lifelong learning. Creating in your own way, and that may be professionally, it may also be personally, of cultivating some creative activity in the arts, in cooking, in gardening, in ways of pulling together aesthetically and getting out of this part of the brain that's more thought-based and being more of a creator. Okay, where are we with time? So we're not going to spend too much time in this activity, but the idea was to start your personal self-care plan, which was one of our objectives, by identifying a broad strategy as a starting point. So we've just gone through 13 broad strategies and thinking, okay, which of those am I maybe not attending to in a way that I could benefit from, or where are my strengths? Where am I really attending to, and how could I build on those strengths? What's a broad strategy I'd like to focus on? Is it attending to the body? Is it starting to think about how to be engaged in activism or creativity? Or is it by changing, finally buying that nice office chair so that I'm a little bit more comfortable in my telehealth sessions throughout the day? That took me like over 14 months to do, which once I did it, could not understand why I hadn't done it sooner. So if you're still stuck on that one, go for it. Okay, quick check-in here. Again, and I'm moving through these a little more quickly than I'd like to, but I am just being aware of time and wanting to get through our material. So notice your breath, your physical tension or softness, your emotional tone, your thoughts and focus, your energy. Okay. Oop. Moving into some practical prevention. Some of this again comes from Youssef, who had talked about those 3 areas in which workers were talking about burnout, feeling overworked, lack of role clarity, and lack of perceived control. So we're going to talk specifically about things that have to do with burnout and what most of our lives may look like in COVID. So 46% stating that they were feeling overworked. Video meetings are more exhausting to the brain. It's been proven. Neuroscientists have proven this. Microsoft Teams 2020 did research showing that there was a significant uptick in beta waves, a marker of alertness and attention, while engaged in content through Zoom or video format meetings. Same content, same duration, uptick in beta waves. It takes about twice as much effort to meet by video than in person. The brain is spending more energy to pay attention to the same information by video than it would if you were in person. And after 30 to 40 minutes, it was also demonstrated that there was a drop off of beta wave activity because the brain's exhausted. So it's working, and then it just stops because it can't focus anymore. You may have experienced this in some of your sessions. So what are our practical solutions? The biggest drain on the brain is monitoring self, which is extremely biologically unnatural. So that little window with your own picture in it up to the right-hand corner is the main culprit in draining your brain and creating increased beta activity while you're on Zoom or Doxy or Simple Practice. You can turn off the self view on all of these platforms because these companies have workers that were on Zoom who were complaining about meetings, and they did research and they found, sure enough, it was draining productivity, and so they changed it. So you may have to go in and get advice from your tech savvy little ones probably, and find how you turn off the self view. You can do it in Zoom. You find the little 3-dot ellipse, you hover over it, you scroll down, it says hide self view, and you don't have to look at yourself anymore. And if we think about this, it makes so much sense. It's so distracting. How many of us have, thought, oh, that's what I look like, or checked in and gotten distracted by our own facial expression during a meeting. It's just too much to monitor. And we never used to have that input. I'll actually acknowledge when I first read this research, I decided to turn off the self view. The first couple hours, it was extremely disconcerting because I was so used to seeing myself. And I thought, well, what if I'm missing something, And then I thought, well, I never saw myself for almost 20 years of doing therapy in office with people. And maybe twice I went into the bathroom after a session and found out I had spinach in between my teeth and wondered why nobody told me, but it wasn't the end of the world. So, hey, if that happens via Zoom, I can survive it. And I will say at the end of my day, I'm less fatigued on my video platforms now because I'm not monitoring my self view. I am monitoring my self view during this session just because so much has been going on, and it's contributing to some fatigue. So turn off your self views. You can coach your clients to turn off their self views on the platforms. You still see them. You get everything you need. Neither of you are preoccupied with the self view. You can shorten your sessions if you like, but I know that we're all tied to our CPT codes for reimbursement. So if you don't want to shorten your sessions, take a break at the 30 to 40 minute mark and check in with your client, coach some diaphragmatic breathing, complete the stress cycle, do one of those check-ins like we've been doing. That will help in that moment of the brain getting a break and checking in. It can probably gear up for those last 20 minutes or so. And your client is also fatiguing because they've been on the video platform as well. So it would be a mutual benefit. Okay. Meyer in 2011 talked about uncontrollable stress being more toxic. The exact same stressor can have a little toxic effect if the subject has a sense of control over the situation. So if there's two yous, there's the you that feels like this has been put on you, it's a burden, and then there's the you that says, okay, I'll choose to pivot and shift gears and deal with this. That you is going to feel much less stressed than the you that feels imposed upon. So manufacturing a sense of control by stating to yourself, I am choosing to accommodate this request, this deadline, this whatever it may be. Making a decision regarding your day and how you will or will not adjust it in a manner that is in your control. So this would be especially the case for psychologists working in systems where things, may be put into your schedule unexpectedly, or maybe you're expected to be at a meeting or to get something done on a timeline that wasn't your own. So being able to try to manufacture agency and ownership over that, which is going to help reduce stress ultimately. Diaphragmatic breathing. We talked about this a little bit before. There's tons of breath practices. I can tell you from yoga, we might even get to another one later, but the one that has an evidence base for immediately shifting from sympathetic into cueing parasympathetic response is diaphragmatic breathing. It creates a sense of control by completing the stress cycle. It activates the vagus nerve, which signals to the brain to turn up parasympathetic response and turn down the sympathetic nervous system. And this is a visual of the vagus nerve I was describing earlier that originates up here. It's the 10th cranial nerve. Literally goes through and touches upon just about every system in the body, ending in the deep gut. Some ways of cueing diaphragmatic breathing. If you haven't checked it out, the Exhaler, xhalr.com app is wonderful. I would pull it up and share my screen with you if that wasn't so confusing. But it's those circles again that come out, inhale, exhale. You can build in a pause, and you can build it. There's a little ellipse at the top, and you can say you want it to be at 3 seconds and 6 seconds, or 4 seconds and 8 seconds. And then you don't have to worry about counting. You don't have to worry about anything. You can keep the tab open in your day. And when you're in between clients, you can just cue 3 minutes of breath and reset the stress cycle. Headspace, Insight Timer, Calm app, Peloton has a meditation app now. All of these will have other ways that cue breathing, but not necessarily diaphragmatic breathing. Okay, 32% of people stating in that asana study that they're not being able to switch off or disconnect in their work. Work satisfaction and productivity relies on having a dedicated workspace, and that's become harder and harder when we are doing remote work. Why is this the case? Home has cognitive associations to rest, relaxation, and sleep, or at least it did 18 months ago, maybe not so much anymore. So the brain is confused and at odds with getting into a professional headspace or a focused headspace. So the invitation here is to reclaim your home and find ways to make it, again, a space of rest and relaxation, but also a space that can be a focus space if you need it to do, if you are working remotely from home. So how do we do that? Again, this comes from Yusuf's work as a neuroscientist. Introducing a physical or sensory trigger into a location to create and design a cognitive association between that object or sensory trigger and getting into a focus mode or professional headspace. So ways of doing this, we talk about the 5 senses, which come up a lot in meditation and mindfulness. You can have a focus candle. So I love candles. I read this research because of doing this workshop. And so I got to go buy a new candle. My focus candle is Signe Hale's rosemary and lemongrass, both of which are scents that are activating and focusing. And I only burn this candle when I'm working. I never burn it when I'm relaxing at home. Having a uniform, having certain clothing that you wear when you're doing your work that you do not wear when you are relaxing. So going from doing your yoga practice and walking your dog right into session, probably not a great idea in terms of cognitive associations. Having a tablecloth or something, if you're working remotely and at home and you want to separate the space, you can put down a tablecloth when it's workspace or when it's rest space and remove it when it is the alternative space so that you have a visual cue. This is what I'm doing here now. And then I put it away and change it when I'm trying to do something else. Yusuf also talks about having a work mug, the cup she uses for when she's working, different cup when she's relaxing. And then music. You can have music that you listen to just when you're working and different music when you're relaxing. So don't choose favorite music because then you can't listen to it when you want to. So changing the cognitive associations. Lack of clarity on tasks and roles. Thinking about time management, prioritizing your to-do list to 1 to 2 essentials versus the overwhelming big list of to-dos. For some reason, time management has affected everybody with COVID. In some ways, it feels like we should have more time, but in some ways we have less time. And I think it's because we're trying to do more throughout the day because maybe we are at home. And so it doesn't feel like a big deal to start dinner or put a little laundry in, but all of a sudden we don't have those little shifts and breaks. So Yusuf talks about developing a most important things list or most important task list, which can create a sense of control. So the idea is you have your big overall to-do list, but then maybe you have your couple things. And this may not be your clients, they're in your schedule, but that phone call to a provider for a collateral contact, or that insurance call that you need to make to clarify why the denial was made, like the 2 things you really want to get done, or your CHAQ attestation, or the things that just you don't want to lose track of. Write them down on a piece of paper instead of on a big to-do list, cross them off at the end of the day, or once they're done. If they're not done, rip up that piece of paper, start again the next day. And it gives you a sense of accomplishment, gives you a sense of control. All right. The personal self-care plan. Again, building on success, diversifying, and thinking of a deep well, wide margins, and firm boundaries, which comes from Lisa Heinz's work. All right, the deep well. Psychological resources. So we've talked some about these: psychological capital, hope, optimism, self-efficacy, promotes compassion, especially toward the self, and provides a firm foundation in resiliency. It's related to the positive growth initiative, positive and proactive stance towards change, and continuous self-improvement. This is out of Meyer's work. Focusing on what is going well, celebrating your successes. So even having a, I can't access the word I want right now, a montage of the positives, of the good news, of the things that have been positive in their practice in that day, in that week, in that month. Physical energy, mostly through movement, is one of the most effective ways, and spiritual inspiration, meaning and related purpose in your work. The wide margins refer to time, essentially time built into the day for breaks, and mindful participation in self-reflection and creative practices. And there's evidence that when people tell themselves that they have time, they take a deep breath, relax, and allow themselves to take their time to mindfully go about their task. Firm boundaries. Personal boundaries to ensure time for self-care and life enrichment. Recognition that it is not selfish to focus on our own needs, it is self-preservation. Professional boundaries to reinforce appropriate work hours and an enriching work environment, and ethical boundaries with clients. The recognition that it is not selfish to focus on our own needs, it is self-preservation. The majority of people find it difficult to get back on track after allowing good habits and firm boundaries to lapse. So establishing and maintaining them, because once they lapse, it's much harder to establish them. All right. And from Brown, this is Brene Brown: compassionate people do not give of themselves without limits. They know what and how much they can give. They do say no to some requests so that they can say wholeheartedly, say yes to others. All right. So the stress-distress continuum here, we've been talking about burnout, and we've tried to touch a little bit on self-compassion that can lead to more of a sense of flourishing. But this is one description of a continuum that we can be in crisis or impairment, in which we can be very anxious, have low mood, absenteeism, exhaustion, poor sleep, weight loss or gain, as we've seen from the COVID statistics, struggling, anxious, depressed, tired, poor performance, poor sleep, poor appetite, surviving, which is worried, nervous, irritable, sad, trouble sleeping, distracted, withdrawn, thriving, positive, calm, performing, sleeping well, eating normally, normal social activity, and then excelling, cheerful, joyful, energetic, high performance, flow, fully realizing potential. So starting to look at ways in which we're not so much focused on just avoiding burnout, but we're more and more focused on evidence bases that help us move into thriving and excelling. Bryant proposed her own version of this broader continuum concept from flourishing, surviving, stress, distress, impairment, and then that risk with impairment and burnout of improper behavior. So taking just a moment in the interest of time to visualize a moment of flourishing. What did it look like, feel like, smell like? What could you hear, taste? Where is it in your body? A moment of flourishing, that we have to know what we are headed for to be able to access it and go there. The self-care roadmap. So how do we put all this into some practice? This is one way. There are many ways of doing this, but the one way, one of the ways that I like, and I utilize this in my practice with folks. I'm a big fan of Dan Siegel's work. This is out of his 2011 book, Mindsight and the Healthy Mind Platter. You may be familiar with the different domains that he suggests for maintaining good, healthy mind balance. Having focus time, when we closely focus on tasks in a goal-oriented way, taking on challenges that make deep connections in the brain, playtime, allowing ourselves to be spontaneous or creative, enjoying novel experiences, making new connections in the brain, connecting time, connecting with other people, ideally in person, physical time, moving our bodies aerobically if medically possible, strengthening the brain, time in when we quietly reflect internally, focusing on sensation, image, feeling, thought, helps better integrate the brain. Downtime when we are non-focused without any specific goal, let our mind wander or simply relax to help the brain recharge. And sleep time when we give the brain rest it needs, consolidate learning and recover from the experiences of the day, let the glial cells do their jobs. So all of these are important. And one of the things I may have people do is draw that pie chart of the essential mental activities and then look at what's missing or what's not getting enough attention. Maybe sleep is really dialed in, but connecting time is really lacking. And that can be a good place to start on the personal roadmap for self-care. So you have the broad strategy from Norcross and Vandenbos, and then maybe look at, okay, I really need more play, or I need some physical time. I'm not moving my body enough. So I'm going to skip through this activity right now, but I encourage you to do it on your own of balancing your plate. Take a minute to draw your own healthy mind platter. Are your portions in proportion? What are you not serving enough of? And use that as a starting place for your own self-care plan.
Maura, this is Nathan with a question.
Yeah.
One of the participants was looking for the reference, like the article reference on the impact of beta waves in the brain with increased virtual care and virtual meetings.
Okay, that's from a Microsoft study, and it was referenced in Sahara Yousaf's talk. And I can, if it's in the chat and we can get the person's information, I can get the specific reference. But the study was done by the Microsoft teams.
Okay, great. I can record the person's name and forward it to you.
Great. Yeah, thanks. Yeah, super interesting stuff, those studies. All right, so the little bit of bias here I will acknowledge, in part because we see the the isolation, the work demands, and what's potentially the lack of movement for most of us because we're seated in what we're doing in our work, that these can be really good access points to your self-care plan. And McGonigal's most recent book, The Joy of Movement, oh, there's a typo there, talks about the benefits of movement for the body on so many levels. So in her book, she kind of examines evolutionarily where do these things come from, including examining why do we have a runner's high? Like what function or purpose does that serve? And in that process, she found that 20 minutes of moderate level activity activates the endocannabinoid system. So not actually just the endorphins are released, but the endocannabinoid system is activated. So the same system we think of in cannabis use, which is don't worry, be happy, but without some of the downsides of low motivation associated with the actual use of cannabis. And the thought behind this was that it stems out of the need to persist in moderate level activity that goes back evolutionarily to our hunting and gathering days. So we needed to maintain a certain pace of activity. And so having a reward for that built into the brain makes a lot of sense. So that's the hypothesis that drives this idea, and that it's not necessarily that high level activity or that slow activity, but moderate level activity that can activate that system and create joy. Also, findings that positive emotions were elicited when movement is in synchrony. So dance, flow yoga with coordinated movement or breathing, or martial arts, that our brains are again attuned to another person. And perhaps this has to do with that same network eliciting compassion, but more positive emotions are elicited. As soon as music turns on, people start to move within a certain rhythm. When people are cued to move in synchrony, there are systems that activate positive emotions. And then time in nature that activates a sensory default network connected to the entheogen system. So this system is the one that's most closely related to the psilocybin, ayahuasca, LSD system. And I'll read a little bit more about it from my notes. The green exercise, so exercising in the outdoors or in nature, most closely resembles the entheogen category, including psilocybin, ayahuasca, and LSD. The entheogens are plant-derived substances described by advocates as consciousness expanding. Like green exercise, these drugs alter consciousness by temporarily reorganizing the default state. Unity sensation, a feeling of union with something bigger than oneself, accompanied by a wave of love and sense of deep harmony. Modern humans have inherited the ability to be deeply moved while in nature because transcendent states helped our ancestors carry on. That's the concept behind this. And the green exercise movement is just showing that the benefits of not just moving, but moving in nature. And the reference to the default state is that when we're often in that default thinking state of the rumination list of what that they showed is activated in most people when they just lie in the fMRI machine without being given a directive, that we move into a different default state when we are in nature that's more cued to embodied sensory information. We're not noticing patterns, we're noticing colors and sensations, and that there's a benefit to that being in the physical environment. And that's outlined in her most recent book, The Joy of Movement. So she states, during physical activity, muscles secrete hormones into your bloodstream that make your brain more resilient to stress. Scientists call them hope molecules. So who cannot benefit from a little bit of hope? All right. Some more benefits of nature in a representative sample of almost 20,000 individuals. Individuals with at least 2 recreational hours in nature a week report significantly greater health and well-being, consistent across groups, and it did not matter how the 120 minutes was achieved. So walking, hiking, running, forest bathing, just being in nature. And forest bathing, for those who aren't aware, is literally just laying under a tree and breathing in nature. Exposure to nature linked to improved attention, cognitive benefits, working memory, cognitive flexibility, attentional control, lower stress, better mood, reduced risk of psychiatric disorders, and increased empathy and cooperation. Contact with nature associated with increased happiness, subjective well-being, positive affect, positive social interactions, a sense of meaning and purpose in life, and decreased mental illness. And some evidence that just images of nature can be beneficial. So one of those practical strategies may be to have a reference book of nature photography or nature calendar in your office that you can look at in those moments between sessions when you're trying to do disconnect so that you can engage the 3M framework. And play. So play has been shown to release endorphins, improve brain function, improve memory, enhance coping. Adult playfulness is robustly associated with life satisfaction and well-being. Play is critical for sustaining social relationships and for creativity and innovation. It's scientifically proven to be useful. Play is nature's greatest tool for creating new neural networks and for reconciling cognitive difficulties. So we see that role mentioned by Siegel, but also in Brown's work of neuroplasticity with play when we do novel things in creative ways. And play is how we're made, how we develop and adjust to change. It can foster innovation and lead to multi-billion-dollar fortunes, but in the end, the most significant aspect of play is that it allows us to express our joy and connect most deeply with the best in ourselves and others. And there are many, many ways to play. There are no rules or shoulds or supposed tos in regards to play. It can be, it's one of the things I usually keep in my office when I used to meet with people in office was bubbles. And I've had 73-year-old men blow bubbles in my office, and it's effective in terms of shifting gears. All right. So some best practices. Psychologists are challenged by lack of movement and activity, isolation, overwork. Recommendations are to incorporate movement and social connection into your self-care plan, some form of movement and some form of the competence constellation that we talked about earlier. All right. This is our last activity, and then we'll have some time for some questions and just thoughts and comments. I'd love to hear how people are doing and your own experiences of what we've all been kind of managing in these last 18 months. So from a yoga perspective, I wanted to give a couple things just because it's one of my practices that I integrate in my work for the in-office, the brief, the micro strategies of the 3M concept. So one of them is the breath of joy. And this is a pretty simple breath that incorporates a little bit of energizing breath and a little bit of movement. And it's pretty simple to do. So you would break your inhale down into 3 parts with 3 different movements, and then you exhale in 1 long part. And I'm shifting back a little bit so you can see me. You can do this in your office chair. You can do it standing up. So you would inhale the arms to the front, inhale the arms to the sides, inhale the arms straight up, and then exhale forward fold over your legs. And you can do that quickly or slowly. So it's your pace, but often it's coached to do a little bit more quickly. So it might look like this. There's no contraindications to this, but you also want to be cautious that you don't get dizzy when you're rolling up. And when you're doing that rapid breath, sometimes referenced as breath of fire, it can be activating. Sometimes people, might report getting dizzy, so you want to be really cautious of that. But it's energizing, and it's one of the things that can actually build vagal tone or parasympathetic resiliency, because it teaches the nervous system to tolerate little bits of stress that resolve very quickly. So that's a nice one to just invite a little bit of movement into the body with an energizing breath that you can build in between your sessions. Another one is humming bee breath, which is a different breath that we don't often talk about. It doesn't have those benefits of shifting from sympathetic to parasympathetic, but it can be a nice way of disconnecting. And it's supposed to activate the pineal gland. And the idea is that you inhale and then you exhale with your lips pushed together so that you're creating a humming sound. So imagine the sound of a beehive. So you would inhale, exhale. You'll feel sensation on your lips. And this is often also taught with a sense withdrawal. So the idea to heighten it would be to take the thumbs and plug the ears, and then to take the pinky fingers on top of the eyelids and close the eyes so that you have a sense withdrawal from your environment. And you would do maybe 6 rounds of that breath, inhaling through the nose, exhaling through the closed lips, creating that humming sound. And this is has a little bit of evidence. It's not great methodology, but there are some studies that show positive affect and good regulation of mood with this breath. And then the last thing is a hip opening. We sit in our chairs all day long. So just thinking of switching up your seat and doing a figure 4 stretch, which is pretty accessible to most of us in our chairs. You would take one ankle and cross it over the knee, the alternate knee, and then press down on the outside knee. So if my left ankle is on my right knee, I'm gently pressing my left knee towards the ground or inviting it towards the ground. And then if you want more stretch, the further you lean forward, the more stretch that you'll get back into the piriformis and back of the hip. And just doing that a few times throughout the day when you can't get up for a long time between clients can be a really nice way of breathing into the hips so that you give them some break and you don't have to have injury from sitting so often. But the best is to get up and go on a walk if you can. And I know this isn't accessible to everybody, but most of us can find some version of it. And there's lots of ways of finding resources online for modifying some of these activities. Okay. Returning to the beginning, coming full circle. Return to your initial activity and the items you identified as sources of joy. So here's me with Hazel. How can you invite these into your life on a daily, weekly, and monthly basis? Where do you want to focus your efforts at catching joy? And one last check-in before we move into some questions. It's been a long afternoon. Notice your breath, your physical tension or softness, your emotional tone, your thoughts and focus, your energy. We'll go to some questions. I also have my email and my website information here in case you have questions you want to direct to me that we can't answer now. And I have some notes on that Yusuf talk here, so I'm going to see if I can find the reference to that study also. But if people have questions or comments, I'd really love to hear from all of you. And thank you so much for being here this afternoon, and especially for sticking with us through our challenging start today.
So just as a reminder, we have about 4 minutes left. You're welcome to type your questions into the chat.
I just pulled up the chat, and whoever wrote healthy selfishness, it's all about me for a while. I love it. Oh, nice. The reference on Neff's inner critic. Thank you. Yes. Let me see. Oh, thank you, Rebecca. Rebecca is one of my colleagues on the Confidential Peer Support Committee, a wonderful, wise person who anybody would benefit consulting from. Thank you, Rebecca. So I'm just looking to see if I have my notes that included some of the resources from Sahar Yusuf's talk and that Microsoft study. But if I don't have them with me now, I can absolutely find them and I can send out, and we can probably find an email to the group and send it out to everybody.
Thank you, Maura. Just let me know if you'd like to conclude, and then I can provide everyone a verbal review of the code that they'll need.
Okay, sounds good. Thank you for the feedback, and we will conclude, and just feel really welcome to reach out for me at any point. These are things I love to talk about. Consider me part of your competence constellation, and reach out as needed. And I hope to connect with somebody, some of you or all of you in person again soon. We're crossing our fingers for OPA 2022 being live and in person, right?
Well, that concludes our webinar. Thank you so much, Dr. Sullivan. And thank you all for joining us. A survey will be sent to you all shortly, and one of the questions will be asking for a presentation code, which has been posted in the chat. The code is OPA 1121. Thank you all again, and enjoy the rest of your day.